So, hi everyone. So, those of you just now joined, let me introduce myself. My name is Dr. Shahriar. I've been an AMC tutor for the last 7 years and has been taking classes, on and off. So, I think a big, part of my life is going into AMC classes. Try to be dedicated. We do have very good feedback so far, so good. As long as you keep doing hard work, that all matters actually. So I feel along with my students, I also keep working hard with them. So that's all I can say about myself. uh, Eventually that result that talks eventually, we have, if I include that, last few April doctors, so we have come across like 940 doctors passed the AMC exam from our academy. It sounds very good, right? Like, when the number is about to reach, 1000, that's pretty big amount actually. There's like another more than 200 past lab. That's a different thing, but uh, numbers are good sometimes actually. Number can, challenge you and as a tutor and all these things. Let's not get there. And I'm just going to share my screen in a second, which I think you will like. So first, I like to ask, what you are expecting in this class. So do you want me to tell you more about, what to do after MC1 first, or do you want me to straight away take you to the, teaching, MC2? Now, those of you just now joined for the first time, we have taken a session on MC Clinical just few days back. So in this particular group, like MC Clinical Alpha 7, you can check that one. All right. That, which exam to choose, MC Clinical to choose or face-to-face. That's something particular part we have discussed already, but don't worry, we will be discussing a bit today actually, so not a problem actually. So we'll start from the scratch, not a problem. So let's find out in the comment section. We have some doctors came up. So first of all, and I like to congratulate all of you on passing MC part 1 exam. So you can also congratulate yourself. So like you can type something, about yourself or us, whatever it is, that's fine. So thank you for joining the session. And as I said, like, you can, today's open link, you can copy and share it to your study partner. Probably ask the partner or give a missed call to a partner to join. So that's all actually. So in that way, so what do you want to know first actually? Like, um, showing a role play first actually, or is it like a, uh, what to do after MC1? We talk about that one. So please do let us know in the comment section, and then, proceed accordingly that actually. So I'll follow what you ask actually. So some job related or MC info, what to do after MC1 you want, or we'll get back to, this like a slide coming on pediatric, child with some vomiting clusters. Okay, so most of the doctors I think looking for what to do after MC1. There's a lot of confusion that is there. So this is expected, I think. But some of you are not typing. So this is like, more, like a communicative class. Some cases we'll ask you to open video, some cases. So please note our classes are interactive. And when you go to our main classes, today we might not request too much, but when we start the main classes, like, that closed group classes and all this thing, usually we do video role plays. Like you can see me, I will also supposed to see you actually. That is how that, MC part 2 class is all about actually. So those of you who don't mind, you can open up your video at your convenience. That's all I can do actually. All right. So I think most people are still looking forward to that particular thing, that, what to do after MC1. So let's come with a nice colorful slide about this one, that what to do after MC part 1. There's a relevant video exists, but still let me tell you what to do actually. Now, few things about MC part 1. Guys, you can also ask me question in between. You have an open thing, so you can, yeah. So this slide has been updated. Sorry, I need to update that one. This is 900, and I think, it's 40, if I count the clusters actually. So this was a slide of, I think, earlier, so we didn't update that part. Now, some of the few things in the topic, like you see, like some English test. So there's a first confusion that comes from the job Australia application actually. Application for job, this comes as a 2-3 parts actually, so that actually includes more sessions. So those of you will be joining the MC2, there will be more extensive session will come up actually, like more meta-analysis and the thing about the jobs. Like one particular job is for the hospital job, one particular job is type for the GP jobs actually. So how to apply, how to proceed, we'll go in more detailing in when the official, the courses we will run actually. But we do have sessions on that one actually, because end of the day, your main aim is to get a job. So English test tip that, job Australia application. This is a session for MC clinical. If anyone here is looking for MC part 1 session, you can leave this session. Is this session is not really for you actually. All right. So job application, then MC2, then PESCI, WBA, CV, and some question answer we'll go through actually. All right. All right. That's the thing. And great. Now, first of all, as I said, like congratulations to all of you. And you can also, like, these particular sessions are more interactive. Those of you are not participating, it's not a good sign, let me tell you actually. So, try participate. So congratulations. So you can write, thank you or anything that you all pass. So congratulations to you, all of you. So you can just comment in the comment section how many of you are attending session, just let's get an idea. And please let us know in the comment section as well from which city basically you are attending this session. So also please let us know that one, from which city. So initially the first thing is to introduce each ourselves. That's very, very important actually. So this is an open session. It's a little difficult to get to know each other. That's fine actually. Great. Now coming to next session, so sorry about that, bit emojis. English test, job application, MC2, those particular thing. Now first thing came up is the English test tip. Now, what do you think? Now, guys, this is open session. Those of you who are interested in opening your own video, I mean, no problem in opening video. You can feel free do that actually. So it's a more sign. I can tell you those are more exporting. They pass the MC2 more early. This is very common actually in this case. So you can, and if you're a female, if you want to use little lipstick on get ready, that's also okay actually. So no problem on that one. Good to see you, Dr. Pawan. How are you doing? Congratulations, on passing the exam. Yeah, good
Hello,
to see you.
hello, sir. Thank you, sir.
Hi.
It's nice
Yeah,
to see
so
you.
nice to see you in a different environment, right? Most
Yes,
in
exactly.
MC1 classes, MC1 classes is mostly like one way. So it's like mostly I'm giving the lecture now. I can't see most of you actually. So it's good to see. MC2 will be mostly like that actually. Now, coming to this part, you can ask me questions in between anytime, or others can ask me question in between anytime. First thing that comes up is actually about the English. Okay, I'll go listen since Dr. Pawan is here. Which one do you thinking, Dr. Pawan, for going for English test? There's three things: IELTS, PTE, and OET. Let me hear your version, then I will tell you which one is better actually.
Thank you, sir. Actually, I already gave my English test the moment I thought of starting AMC journey, and I have cleared my PTE test already.
Oh, that's good. Already, yeah, great. So that's a good thing. And was it a very difficult clearing the PT? As far as I
Mm,
also know, PT is the like easiest among all of them, because OET has become little difficult over the years. Actually, OET is no longer remains as easy as like the before. Actually, so if you ask me one thing, that which test you should take, I would say PT. Actually, PT is easier. PT is also available in most of the countries, so you can done. Now, if you're done with it, it's all good, totally, like respect for that one. But PT, you can appear quickly, get a date quickly, and at the same time, result will come quickly. So if anyone is up to getting a job, in that case, it is like PT, you can finish it very quickly in few days, and then result will come up, right? And you can start applying for that actually. So this is something about the PT, right? So out of these particular things, like exams, that is English test is required for MC1, MC2, and job apply. Now this is another confusion for some doctor, like why actually you need the English test actually. Now some people have that mind, for even for MC2 you need the English test. Is this statement is correct? For MC part 2 exam, appearing in MC part 2 exam, do you need an English test? This is a interesting question. Let's see in the comment section what do you guys think, that do we need an English test for MC part 2 exam? The answer is a no. You don't need an English test for that, right? So this is another thing. So if you are not up to applying job now, and that English test validity period is 2 year, like, and that you have less experience, and you have to you know finish that MC2 in anyhow, either for the getting PR, either for uh, quickly settlement in Australia. uh, So it's better in that case, you can go for English test later actually. But most people try attempting the English test first if they have experience. That's all we have seen so far actually. Okay, but this information is English test required for MC part 1 and part 2 exam. No, but job application, that is a yes. All right. So this is another particular things we wanted to highlight in. All right. So these are the three types, like whilst OET and the PT. So PT, we are more with the PT nowadays. Actually, if you get a date quickly, I think it's easy to also get a date. So you can also go through that one actually. Now coming to few process, job apply, which most of you are here for actually, job apply in Australia. Now, first of all, I'm not sure you have seen this some of the my particular videos or not. Please do let me know in the comment section if you in my YouTube channel have you seen these two videos here, tip and tricks. So how to secure a job in Australia as a doctor, tip and tricks. Please let me in the comment section how I can work as a consultant in Australia. Now you can type that one if you have a mobile along with your laptop. Please type this title like how to secure a job in Australia as a doctor and type my name Shahriar and you will find that video easily. Same thing, I want to work as a consultant in Australia. So if you haven't, please bookmark it or like that video. It will come to your suggestion later. Or if you haven't subscribed to my YouTube, uh, you can find me as shahriaramcguideline. You can subscribe that one and see that video little later will be fine. Okay, so working as a consultant, another thing, working as a general medical officer is another thing. If you are going through the standard pathway, in that case, actually, you really can't directly work as a consultant, but you can certainly secure a senior positions in that case, actually, like senior medical officer or registered positions. Like example, consultant in India, Pakistan, Bangladesh, working as a senior position. Some doctor asked me this one, can it be done directly? It's very rare actually, to be honest. In my life, only 3, 4 I have seen, especially from Asian countries, directly get it actually. But most cases they don't even give it directly. They give it partially actually. So short-term specialist pathway, which is most popular, most of the doctors I have seen in that way. So directly getting a job as a consultant, um, through the consultant route job, and working there for like 2 years. But in between those 2 years, what they're trying is to uh, finish that AMC1 later and securing the visa and all these things. No one wants to go out like in 2 years. So many doctors, they approaches, they were in or working already, but they don't have any MC1. Okay, many approaches me many time actually. Because they have to clear that MC1 and extend their visa actually. All right, so this is the thing. So that pathway under most of the doctors are joining. This is called limited pathway, right? Limited registration actually. So under limited registration, mostly you required MC1, but without MC1 also possible actually, if your CV is really that good. All right, so this is few of the things. There's a very popular website. Have you my next quick question? Have you opened a Yeah, have you signed up yet with indeed.com? It's a quick question. Have you signed up yet in indeed.com? All right. Now see, some people quickly, how about the others? Have you signed up yet? If no, you can write no, that's nothing. But if you yes, please do so that's a good thing, so it's initial. So maybe you can open a bookmark if you're using the laptop. If you're listening to me now, you can open another tab in Google. The few things will come up. So indeed.com. So if you open that tab, you will remember it that okay, I requested you to sign up in indeed.com. All right. So fill up those things carefully. They will ask you for information, and that will be fine. Next is some more other job related websites. There's many other websites I'll show you in another slide. Now, this is another one, where you can apply for jobs actually. Now, one more thing everyone said, I was showing, I think if you remember many of the candidates, that I was showing a slide that my 2017 and 18 doctors, 90% of them are working now already in Australia. This is one of the things, like those post MC1, I mean to say, those post MC1 now 90% are working in Australia. 90% they didn't give up. They were keep trying and they are in the system. Those 10%, what happened to them? You must be interested on those 10% give up at certain point. Past MC1 not matching or happening. They have vice versa in another group, they stayed in Australia. This group number is big, stayed in Australia, clinical gap is huge. So the first suggestion I gave is, okay, come back to your country, take experience for three months. Oh, doctor, sorry, my have kid, and it is difficult to come back, leaving their school. Your career is also very important, other than your kids. Actually, in 3 months, kid will not be illiterate, right? So it's just no offense, guys. So this is that summary thing. Actually, you have to go back for 3 months. Actually, okay. I do have a video on clinical gap in my exam, in my YouTube channel. You can please check that one. What does it mean? Like, so 1 year equals to 1 month. So if you have a 3 years of gap, you need to go for 3 months. If you have 6 years of gap, you need to go for 6 months. It's roughly we said like that, actually. Okay, so please keep that one in mind. Actually, clinical gap is one of the biggest barrier in getting the job. Actually, also another thing, some lucks also required. At the right time, right moment, you're applying the job. Actually, a company has opened a job, and they have been looking forward. A friend give you reference. This is one of the important. Networking is very important, right? If you touch with everyone, that people can also guide you, actually, in that case. So this is very, very important. So this is one of the website will help you getting some jobs and things you can apply. Next coming is a thing, as you all can see, some positions. Now positions like JMO position, SMO position, registrar position, consultant position. Few of the terms you should get familiar, like exam HMO level 2, and there's another thing called HMO level 3. Okay, so most people, apply here, actually, HMO level 2. But if you have certainly good experience, you can apply for HMO level 3. All right. Most of the things are like a junior medical officer, emergency medical officer. These are the particular things. Now, a few quick tips here, actually. Now, some doctor asked me this thing, doctor, what should be the type of the CV? Now, about the CV cover and this thing, as I mentioned, when we uh, officially, when you guys will join at certain point, me or just like a other one to doctor who also take classes, they work in Australia as well. So they shared their experience in that case, especially Dr. Kurish is very experienced, and she also takes classes in Australia with some big companies. So I mean, we don't want to miss anything from anyone. So thing is, like, she will also share her expertise on the CV and things. Now, summary one thing, let me tell you, this one of the common question we got from a lot of candidates, doctor, if I take an experience certificate, because I've been working on and off in many clinics. So see, clinic, hospital, anywhere you work, it is fine. Actually, make sure you get this thing in a proper paper. Actually, that's all matters, actually. And you need to have a good referee. So two referees are important, actually. So you need to have referee, and you need to have referee. If consultant level is more better in that case. Okay. Now thing is here that when you're writing few things, what type of things needed to be in the CV, so one thing that comes up, should I mention, is as a full-time or part-time job. Now, most of you might be working part-time, full-time, it's okay. So, but try mentioning as a full-time job. Actually, that's something they look forward, like you're working as full-time. Secondly, some doctor asked me this question, do I need to mention my salary? See, salary in our countries, and they are will not be matching in any way. So it's better not, you skip the salary part, actually. So working full time, rather you mention the hours. Actually, it is like 40 hours, actually, 40 hours per week, and that's those things, or maybe more like 47 hours or 50 hours, you can mention in that way. All right, so that will be some of the particular things, actually. Right. So keep that one in mind. Like, we are going through, how the basic things will be in the CV to be there. One is like, full-time job. Secondly, your uh, the one I just mentioned. And third will be your position, like position mentioned as a junior medical officer or emergency medical officer. The positions that will match with Australia. Okay, try mention that one. If you come up with a so unusual position in your hospital, that is not matching with Australia, will not help. And some of the CPD things in future we'd like to talk, like, CPD, is it good or not? It is good, but compared to doing some training, is it same? It is not. For that one, please check our the video related to clinical gap. There's a video, so clinical gap, and type my name, you'll find that video for that. Okay, so again, summarizing, these are the positions, actually. So if you think you are a consultant in your country, Bangladesh, India, Pakistan, you can apply mostly for the registered position, which is very normal, actually, getting a senior post. Okay, getting senior post like register post. But please do understand, getting into register post looks very easy, but it will be a very difficult situation for you when you join a register post, because you have to also manage the junior medical officer, senior medical post. So if you never have worked in Australia, it's become little difficult actually. So what is the summary? Summary, it's better you work either as a junior medical officer or senior medical officer. Then maybe next year you can apply for the register post. Actually, that is, your life would be much more easy actually. All right, coming to the next one. All right. So this is how, some of the question. I secure a job. Can I secure a job after MC part one? This is 100%. Yes, you can. If you have experience, luck, and if you apply maximum hospital. One of my, candidate, I mean, student, after trying for a year, got the job, and she like um, sent this message to tell everyone that, tell the upcoming doctors that, try apply for maximum hospital. Initially what happened, some people actually uh, keep applying for 6 7 hospital, then they get lazy. No, that should not happen. That should not happen. You keep applying like for like crazy. You think in that way, like your job might take maximum that 1 year, and you have to get ready in that way. If you get lucky, you'll get it in 3 months, right? But you're mentally, you have to be ready like that. You have to apply maximum hospital, keep in good touch with friends and the HRs actually. Like one round maybe you missed, you get in touch with the HR in Australia. The next time when you apply, they will recognize you. Oh, okay, this doctor has trying harder actually. All right, so this is the thing. Template, no template, like this is not the thing. Template you have to make of your own. We can guide you later actually, because template sharing, of course I will not share my template, so that's it. Everyone has their own template and the thing. But there's a afra CV format which I will share definitely when admission and things will be done. Few things I'm not telling because it's an open class and the thing. So the few things we will be talk about little later, not now actually. Okay, when the course and the things will officially start. Few things we don't share outside definitely. But those will be the doctors joining. They will get to know like more things actually. Don't worry. All right. Now, here is the thing. Yeah, if you are confused about the clinical gap, if you have. So now, how many of you do have clinical gap? Please respond in the comment section. How many years of clinical gap? Please write in the comment section. 1 year, 2 year, 3 year, 5 year. Please write it. No, not yes. Like how many years? Please write it. Write it as a how many years of clinical gap. Write it as 1 year, 2 year, 3 year in that way. Okay, so that will be better. I can give you a compiled suggestion here actually. Okay. See, 1 year, you don't have to think much, right? So those are in just 1 year of period, you don't have to think much actually. You just finish that exam. But what you are going to do, that's most important. If you are start applying job now, if you have like a 1 year gap, it doesn't matter much. Okay. Or maybe you can just join for a 1 month and because 1 year equals to 1 year equals to 1 month. This is one of the things. So those are like, in the borderline of 1 year, you really don't have to worry. Even sometimes we'd say those like 2 years, you also don't have to worry much. Like maybe you can just now join a little bit and apply. So that's usually not a problem. Those like 1 year, 2 year, you can get benefit of the doubt. You can also, say example, if you're going through like example courses and the things, when you apply for job, you can also ask us to give a course completion certificate. That also covers up some of the gap actually. So example, in my academy, we have 5 months of course, and my academy is recognized even in Australia. So the thing is like, you can show that one, and that clinical gap, that period, what you are doing, you are studying AMC. Valid point, right? You are doing something related to clinical, it's fine actually. All right. There's so many questions. It's difficult to answer, guys. This particular things. Gradually we'll get back to in some live sessions, so do not worry on the thing. Someone asked a nice question. That one I like to take, sir. Maternity thing, leave period. Is it taken as a clinical gap? Answer is a no, actually. So if you take a maternity leave period as a taken as a clinical gap, no. You can, if you can show that you are in maternity leave that particular time, so probably like a 6 months period of time, they can allow you actually in that case. Okay, that's one of the point actually. Uh, make sure you didn't give 2 years for a maternity. Some one doctor previously shown, like, so say, how long have been pregnant? Then, that was a funny question in an interview board, actually, that, so sir, I was in maternity. Oh, maternity for 3 years. How many kids you have? No, one. So one kid and 3 years. So, in our culture, we know that growing up with a kid and the things are different, needs more care as a parents. In our countries and in some countries is very, very careful, but in Australian culture they are also careful about kids, but they don't accept that one, that okay, maternity, why person is taking 2 3 years. They can't digest that particular thing, unfortunately, that why 3 year, they really get surprised, actually. Okay. Okay, so can I secure a job after enrollment? Is if you have experience in all these things, yes, definitely. With good connection, you can do that, actually. All right. Next coming thing is like called few things like PESCI, right? PESCI or WBA. Do you want me to tell 1 2 words about that? I mean, uh, quick information, WBA related, we have one video. One of my student was previously from WBA, but she was taking my MC2 course because she heard about good reviews, and then she was going through that. She said, like, with WBA program, lot of cases are very similar to MC2, because in WBA system it's like a program in 1 year program, and after that, eventually you finish that one, and then you get also general registration, actually, so which is a good way to get inside Australia. But criteria for WBA, you need a job first in Australia. You have to be inside Australia, and you need to have a job in Australia. So these are the criteria for WBA. WBA is only accepted in 7 hospitals. Monash is one of them. Otherwise, I think all of the hospitals in the periphery. Okay, correct me if I'm wrong, actually. So only Monash is in the central, in the cities, but other WB hospitals are a little bit out of the city. Okay, so these are the particular things, actually. All right. Great. Guys, I'm sorry, all question I cannot take because we have a session to also cover, actually. Like, we have a session coming up with pediatrics, child with vomiting case, actually. Now PESCI is a system, like, now, like, there's 3 system of PESCI. There's mentioned 2, like RSAGP and ACRAM. There's 2 PESCI. So what is the criteria for PESCI? Let me tell you in shortly. Like, when you come to our MC2 courses, there will be a separate session on the PESCI. I mean, by the way, I don't teach PESCI, actually, because I never gone through the PESCI. Now, thing is, it means pre-employment structure clinical interview. You need to pass MC1, you need to clear English test, and you need a job offer first. Okay, so when you get the job offer, then they offer you, because you have a lot of experience as a GP. You need to have need to have experience as a GP, otherwise you'll not be counted. This is one of the thing. So when you get that one, like, as a PESCI and particular things like that, then you get a job offer, and then you have to go through the PESCI exam. Please note that PESCI exam is also not so easy exam, actually, and sometimes a lot of doctor takes a lot of time, and hard time pass, because unfortunately that AMC2 has so many natural, like, we run courses, Australia has courses, and also many people run good courses. Unfortunately, in my observation, not as a offensive or anything, the PESCI courses runs by few 1 2 people are too superficial. They don't really cover the theories well, or whatever coming in the exam, not up to the mark, actually. It's my personal opinion, actually, because I get feedback from a lot of candidates. They said, oh no, doctor, why don't you open a PESCI course? You have been very good, like, because all the courses you run are very good. But I said, like, no, see, I didn't go in through the PESCI. If I hire some people run a course, there are some risk, actually, in that case, actually. So the PESCI, you need to study a lot by yourself, actually, because a lot of cases, and which is not covered in those courses, actually. So this is one thing that is very, very important. All right. Great. Now, here is the thing, those PESCI I'm talking, this is the website for the PESCI. Talking about, this is not a medical route, this is the GP route. Most cases, you are likely to get a GP job in the peripheral side of Australia, because periphery in Australia looking for more doctors. It's very normal, actually. But it doesn't mean you cannot get a job in the centrally. Many of our doctor even living outside Australia, actually, they apply mostly centrally, right? Like there is a thing, like, if you're a PR holder in Australia, you might not get a job in the central hospitals in, right? So there are few things like that sometimes. But their rule regulation keep changing. Look into that one actually. Next is a workplace based assessment. Few of the things, guys, I'm going a little superficially because we have a session to conduct. And course, actually, when courses start, we'll be like me. Limon is there. Limon is working in Melbourne. Dr. Kurish is working in Sydney. Then Henny takes the psychiatry class. She works in Perth. So it's a good combination actually. And all tutors we instruct to guide something about more about the job. They're even more expert on the job part because they are in the system right now actually. So you'll get more care and supports in that cases actually. And just to add, in MC clinical courses, our total seat, like 30 to 35, we closed it. Last batch, same thing happened actually. We closed it after that. So just for information, that 20 seats are booked already, and we'll be just closing. I think it will take this month will just remain open. Once the cut off that 30 will reach, we'll just close it. In between, requests keep coming for our students. We'll keep those 3 4 seats, for some upcoming months. So some people come and really request. And I'm more comfortable with the doctors who gone through my MC1 joining rather than new doctors actually. All right. So those, if you have gone through, because a lot of things I know what I have covered in MC1 and what I need to cover in MC2, I know it very well because I was your mentor there actually. So what part I have given more emphasis there, I know it very well. Example, if you remember in orthopedics, I was not really teaching pulled elbow much because it really does not come in MC1 exam. But pulled elbow is a super important case in MC part 2. So these particular things, I know what I have taught you guys. I have to give you a more brief on those particular things actually. So I'm more into comfortable with working with our MC1 because slots are limited. So I'm not much into taking the doctors who were not our students before actually. Okay, so this is one of the things, but you are welcome to join actually. You are welcome to join. If you get to know or you get to know about us later, that's fine actually in that case. All right, so WBA workplace based assessment, here is some information about WBA. Before you take part in workplace based assessment, you need to pass MC part 1 and need granted limited registration. So it means you need to work in Australia already. It means you need to work in Australia already. Great. Right. There's a video already given, if you go and just see WBA workplace based assessment and type my name, you will definitely find that video. One of my student who already in WBA system. So probably uh, it will be great actually to see that video actually. And it was more detailing about the workplace based assessment actually. But one thing superficially, if I say, you need to work inside Australia first. Actually, you need to have the limited registration and working in Australia to get the WBA program actually, right? So this is few thing about the WBA. All right, now CV related tips. Probably I already gave little CV related tip here actually. One of those where I was mentioning that you need to mention full-time job, or if you can show it as a full-time job. Good referees, consultant. I mean referees as a consultant. Please make sure you don't choose any referee who is like a dinosaur or fossil. I mean, no offense. Some professor never check their email or anything. And your job related thing will come up and unfortunately it will go away. How important is that? So anyone, I would say a little young than senior professors like a associate or assistant professor, that also works actually, or any consultant that works, which you have good connection and this doctor is active in the email and the things. Now one more thing, how you will be notified. Normally they send the email to the referee. If referee not responding, you will also get an email at the same time. It's kind of like crisscross. So at the similar kind of time, you will also get notified that the email is going to the referee. So you can inform the referee in that case. The please, can you check, I have my job related referee thing came up. And they need to fill up a lot of things actually, and that part is tricky actually. I filled up few before, like after that I stopped it actually. It's time consuming thing, so I unfortunately don't have that time issue. I wish I do have time and I can fill up everyone's actually, but that's one of the thing actually. So anyone who is capable of filling up, but that's individually one thing takes almost 20-25 minutes actually to fill up. It's a big thing actually, and you also have to write a lot of things about the candidate. So it's directly under supervision. If someone is there, it's become more easy actually. If you're medical college teachers who are professor, it's more easy because they know you well. That's my suggestion actually. And there's a lot of things, tell them to click carefully. Everything they just keep giving excellent and 10. How happens in our country? It is not necessary, I'm telling you. It is, otherwise it will look fake. you know when you just click everything 10, 10, 10 out of 10. How do you recommend 10? 10, okay, like, capability clinical, extremely excellent. So everything if coming like that, that will become little suspicious actually. So just be aware, little bit careful about that one. Tell the professor or the seller, not everything, don't click excellent. Whatever you feel is right, just click. So borderline best is better actually. So make sure they don't just, because to save time, just click excellent, excellent, excellent. And they also give up some point actually. Like initially they said answer supposed to be yes, some answer supposed to be no as well. So when one time it happened with one of the candidate, that everything was giving yes, 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 yes. Like, and do you think this uh, junior doctor is mentally retarded or something like that, like, or not mentally retarded? Now that is a thing. Sometimes they wrote in that way as like a tricky MCQ question. It is also test of those referees as well. So some option came in that way. It's just yes, 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 and they make that doctor, you mentally retarded as well actually. Or is it safe for working with the colleagues? So also like, they might tell, no actually in that way. Or so they will come up with a tricky things like that. So be careful on that one, while fill upping. I know for a moment, because I was also going quick, because I have the habit of rechecking things. So when I was reaching, oh my god, why this one this way came up actually. you know I know RNTU, like, they came up with RNTU. So some of those, like, which of the following is incorrect. So one of the option were like that. Yeah, so later luckily, that's okay. Great. Those are CV tips and all this thing, and that's fine. As I mentioned before, that if you need experience certificate from us, actually those of you finished our course, you can get 5 months actually from us. Actually an MC clinical, if you join, you'll get another 4 months. So we can provide roughly 9 minutes. It is recognized in Australia, by the way. And yeah, so my one is MC and GMC recognized actually, so that's a good thing. uh, Last but not the least, about CPD activities, some doctor asked. CPD is nothing. Any course you can show as a CPD. In your life, anything you have done, you can show as a CPD. You take a training of diploma, you can show it as a CPD. You took a diabetes course, you can show it as a CPD. You took a ATLS, BLS, you can show it as a CPD. But there is a two terms actually. One is the accredited and non-accredited actually. This accredited means, uh, some point CPDs out there actually in Australia with payment. Say you invest $500 and you do the spirometry course. You spend $500 and you do a spirometry course, and that one has a point CPD, accredited CPD. As I mentioned, these are not that useful compared to if you have a training post. Like if you work as a doctor for 1 month, even that's much more better than many CPD. I hope that's fine actually. Doctor, here is not a place to, uh, yeah, Dr. Husna, I think, yeah, I'm not sure it's any marketing strategy or not, or, but Telegram and these things, usually we don't feel much comfortable sharing these things. Yeah.
Yeah, yeah. Hi, Dr. Shahriar. Sorry for sharing. My
Now you need to ask my permission first, actually, right? So
Okay,
we
sorry,
appreciate that one, but
Dr.
you need to
Shahriar, because
ask. Yeah, yeah.
you said you don't have any pesky courses. Yes, yes. Sorry,
I
sorry.
don't
You're
want to
right.
talk to you first. Actually, you also need to take my permission to talk first. Actually, in the sessions. Actually, no problem. All right. Well, I'll talk to you later. If something is useful, definitely, we can do it. Actually, not, when candidates are listening, actually, if you just, the problem was that actually, they will be distracted actually, because they're here like, not for like initially pesky, they're here for to listen and understand the processes actually. Things can be a little distracted in the beginning. Actually, we know that one, if you want to help, you can also post in our group with taking my permission, not a problem on that one. All right. No problem. Because we don't know you, so that's the problem. All right. Now, any question answers? I'd like to take one to few questions. That's fine, actually. And yeah, not a problem. All right. Let's see one to question, but you can unmute and ask me directly. I can see Dr. someone using a tab and I'd like to ask a question. Feel free, Doctor, to ask me questions. You can unmute and ask me questions. I'll take 2 or 3 questions, then I'll get back to the main slide actually for today.
May I
All
ask
right.
my question, Dr. Shahriar?
Yeah. Yes, please.
Okay, I'm Dr. Shahriar.
You can
I've got
you can introduce yourself and then you can ask the question. Thank you.
yeah. I'm Hosna. I'm a
Hi,
GP from
Doctor.
Iran. Yeah, I
Okay,
passed
that's
my
great.
MCQ1. Yeah, and I've done my OET exam and just passed my PESCI exam as I got a job. But I was
That's fantastic.
thinking of yeah, work-based assessment. So I have to go and work for limited registration, like for 6 months, to be eligible to enter work-based assessment program. And this is what I uh, thought I can ask, or am I just going need to do the AMC2 clinical to
All right.
get the general registration? Yeah, thank you.
Okay, for registration. So basically, what's your question here actually? Like, so that's your plan, right? Like, you are certainly got a job as a GP and the things, but for full registration and securing the PR and all this thing, you want to appear in MC Clinical. Is that correct? I'm just summarizing things.
Yes, yeah, exactly. But I've heard you said about WBA, which is much easier.
Mhm.
So I wonder
Much
how
easy
can I
for you.
enter? Yeah.
Yeah, WBA, you can just go and type in workplace-based assessment. So those email and all this thing come up and you can just go and start applying with the WBA processes. And, those hospital with the WBA, you can just, keep applying because you already have that like limited registration and all these things. So you can just on the basis of that one. Are you asking me the, like, what is the procedure of asking the WBA?
No, what was I meant? Is it like a hospital job, or can it be like
Oh,
as
yeah,
a?
yeah. Hospital. It's a hospital job. So
Okay,
it's
so
like a program actually.
mhm.
It's like a 1 year of program. Yeah, it's more like a 1 year of program.
Okay,
And in that program that there will be a lot of exams actually, individually. But normally in MC2, what happens? Everything you studied and you just need to come up in 1 day by full preparation.
one
It's no more
exam.
not like,
Yeah.
yeah, like
Mhm.
example, say, imagine, if you are doing an internship, but this is not internship. uh, but just giving example, like when you are like intern, during internship we have a lot of placement in different department, and some department used to also take out exam for us actually. So
Yes.
in that
Mhm.
case, they were also taking our exam. So here more professionally they take exam in lot of departments actually. So that you
Mhm.
have to appear, while doing that 1 year, that you have to particularly appear in different departments actually. And once you finish that 1 year, you are fully like finishing and
Great.
getting the general registration
Mhm.
in that way. And and you can also apply for the PR. So WBS certainly gives you uh, that chance to get the general registration at the same time securing the PR. I hope that is clear to you.
Okay. Yeah. Thank you.
Thank you, Doctor. Yeah. All right. No worries. And I'll take some help from you. Actually, I'm now after asking you, if you want to share something, you can also let me know. I will share or give you permission to share if you want to share some information materials about the pesky. That's fine actually for them. Thank you, Doctor. Any questions from any other? Feel free, guys. I'll take 2 more questions. Dr. Dinesh, yes, please. How are you?
Yeah, doctor, can I know, like, I'm working in Sri Lanka as a medical officer,
All right,
and it's 7 years of my career as a medical officer.
7 years.
Uh,
All right.
so, which positions I can apply for? Is it a junior medical officer position or senior medical officer position?
Both are applicable for, because you have 7 years. So there's two suggestions for you. One, you can also go with that route, that uh, medical officer, also because 7 year, if you can, convert it anyway as a GP somehow, if you can show in that way. Some people, when try as medical officer not getting it, sometimes they start, try also as GP. So if you can have paper like that, you can also try for the GP. So for you, because 7 years, so both side is open for you. Like you can show in that way, maybe early morning you are working as a medical officer. Of course, many people, they do some chambers, right? So that's like a GP job as well. So if you can show that, 7 years, you also have GP experience, you can also apply for the GP as well, actually. Because if you're GP and then some job can be getting sometimes more faster and it easy, it can be some cases. Actually, I remember one of my very favorite, Dr. Ornov, who passed the MC1 and 2, but because of shortage of experience, he was having less than 2 years. And somehow, the COVID came up. So see, COVID days were a little different. So he was trying very seriously. It was not happening. Actually, I said, see, you are very capable. Actually, you did everything as per textbook, everything as per I said. But because it was COVID days, so he was also frustrated. So in between, what he does that uh, he, with some experience, also applied as GP, because COVID was also almost like 2 years. So by this time, his experience also reached like 4 years. So he showed us that 4 year as GP, and he somehow managed to get a job offer. Then he appeared in PESCI. See, his result was tremendous in MC1. Then in MC2, like he also passed, like he passed like 13 station out of those 14. The result came in 14 station. I hope you all know. Like normally it's 16 station, but the two are pilot. So results given in 14. So Arnav passed like almost 13, 14. So brilliant student. But when for PESCI, he failed one time. So then when I asked like what then, so yeah, mostly we have to take preparation by ourselves in PESCI. So, but that's okay. I mean, it is doable, but just remain serious. Don't take it lightly. If you have good content materials and um, I think PESCI is also getting a lot updated with time. Actually, I think more good resources and the thing will be there. People can pass. Actually, some people are naturally good. Some people need more experience for every exam. So it just depends. Actually. All right. So here's few things. And doctor, you can apply for, I think, junior medical officer or senior medical officer, either of the post. Actually, whichever convenient for you. Whichever. Like first
Yeah,
job, don't just choosy. Actually, first job should choose you. I think it's something like that. Like, so wherever apply, whatever that comes out as a first job, doesn't matter, junior medical officer, you will be promoted to senior if you have experience later. Your supervisor knows you well, that's all you need actually later. Okay, your supervisor realize, oh, you are came as a junior medical officer, but you have so many experience, they will promote you to the senior medical officer then. But getting into the system is more important, and there is more junior medical officer job than the senior medical officer job, right? So in that
yeah,
way, junior medical officer chances are a bit higher. There's also a lot of empty job in the emergency medical officer field actually. So if you also can try, I mean, if someone of you are be related to anesthesia or emergency field working, and there's so many, job application is still, I saw empty in Australia as a like critical care, and then emergency ICU, these things is still lot empty. If you don't fulfill the criteria, they will keep the seat empty. They will not fill up it. This is something about Australia. All right. So that's why during COVID time, doctors have hard time not only for COVID, but to cover up the other empty seats. Actually, now they are taking more doctors. Actually, that is one of the reason last 1 year, like, I was really surprised, like the amount of doctor got job actually in Australia. So this is golden period is going on. I would say this 2022, 2023, and it's still up to 2024. I believe a lot golden period will be going on. Then, a lot, sorry, a lot of doctor will be in the system. Then they will reduce it. for some timing. Then again, when it will be needed, then again they will increase it actually. So every country, see, example UK. Now you must be at, oh, UK is so easy job, this, that. Nowadays they're asking UK attachments, like to get a job in UK. Yeah. So see, I mean, it depends on demand. So over last 2-3 years, it was too demanding. Now it's changing, and they're also changing the format of the exam. PLAB is turning into UKMLA. Maybe you heard that one. So these are the sign that, now they don't need too many doctors as like before actually. Okay, so same in Australia. Now they need more doctors. Maybe from 2025 it will be a bit reduced actually. That's my personal estimation actually. All right, next question I'd like to take. Anyone?
Hello.
Yes, doctor, please. Dr. Tanvir, I think. Yeah,
Yes.
how are you?
Hi,
Hi.
Shahriar bhai. Yeah, I'm fine. I'm
Yeah,
from
hi.
Dhaka, Bangladesh. I am an
Ah,
orthopedist consultant and
mashallah.
doing a government job
How many
with a
years of
lot of experience.
experience?
Experience is I have my
I think that.
graduation 20 years back. I have
Oh,
passed the
okay.
MBBS and I have the ortho 7 years back, and
Okay. Full of
I'm doing the
experience. I mean, no problem.
yes,
You
yes,
can you
yes,
can
yes.
donate some experience to some of the other doctors. Maybe if there is any system to sell.
Actually,
You
actually
don't have been the
handover,
right
lots of
candidate.
handover, like every procedure and
Right.
practice. And actually, as a
Mhm.
government consultant, and lots of experience, and actually degree is ortho, and appearing
Mhm.
for FCP final for several times, but unfortunately not completed. So appearing for MRCS final at 2023 September, Kuala Lumpur,
Okay.
and I
Okay.
think I will pass. I think, and I hope.
No, no, you
So
will. You will.
actually, actually, actually lots of my senior and junior colleagues abroad, like UK and Australia,
Mhm. Right.
and general surgeon. So actually, if you don't mind, by how can I get entry in Australia as a specialist? You mentioned some point earlier in this session.
Right. Okay. See, I mean, specialist thing. What's your status on that MC1?
Actually, I am not appearing the AMC or AMC.
Okay,
One of
just like yeah, no problem. Yeah, that's not a problem.
sitting for
Now for
MRCS.
you, MRCP. Yeah, okay. So you are focusing on that UK route and
MRCS.
MRCS
Uh,
actually. All right.
obtaining, planning.
Okay.
I had the MRCS exam at Kuala Lumpur 2003 September.
Okay. All right. So when you'll be done with the MRCS, like one thing you
Yeah,
can do is a like kind of like
yeah,
direct. You can apply actually. There's two things. One is a
yeah.
uh, see directly working as a specialist in Australia, like it's little difficult for Asian doctors, like getting it directly. Like you consultant in the home country, you become directly consultant there. So this direct thing is become difficult because when you put from, say example, from Bangladesh to here, uh,
Mm.
you never worked in their system, like like a normal doctor came up,
Okay.
RMO, then SHO, then register. So you don't know their post well actually. So this is one of the thing that happens. If you can do something like that, like after finishing that
If I
MRCS,
pass
if
MRCS final,
yeah, past MRCS, but still it doesn't mean the
yeah.
system of Australia. If you can work in UK for 1 year and then you migrate to Australia, then
Yes, yes.
they will give you that kind of privilege more easily. Otherwise, the position that will be lucrative for you is a short-term specialist pathway. Okay, there's another thing called short-term specialist. For
Mm.
2 years, you will be directly inside, but eventually to extend the visa and get the registration, you have to finish MC1. So as I mentioned earlier, I got in touch with so many doctors. Those have been consultant in India mostly.
Mm.
So many doctors have been working. They're consultant and they're in the system, but they never pass the MC1. So many times they, as an emergency, my number is with everyone, I guess. So they're just calling,
Mm.
I have to clear in 3-4 months left. I realize now, I don't have much time. I told, okay, you should come a little earlier. Actually, if it's about AMC1, I said, no, now we don't have choice and the thing. So sometimes, they come up with a shorter course and things like that. But the summary is they have been working inside Australia already, under limited registration. I was going to Circular Quay, the famous opera house, and one doctor called doctor this that, says I'm heading towards opera houses. Okay, can you meet me in between the station actually? Okay, okay, because I was going to meet some friends actually. So okay, let's have a meeting for 15 minutes. So in between going to the opera house, there was a station. So he came to that one. Then we have the coffee, and he said, like, he had been working for 1.5 years, and he appeared only in MC1 exam, and he thought it was easy, but he couldn't actually. Then somehow from some friends he got collected my number actually. So he has roughly like a 4 months left. So I said, okay, you go through a crash course, that would be more better in that case, but just make sure you finish it. And he was desperate to finish, but in second attempt he cleared it actually. That's
Okay.
the point actually. So summary here, what I want to show that,
Yeah.
so he was in the system without MC1, but
Hmm.
at the same time, he also had to go through that uh, particular part 1 exam, but later actually, because he was under short-term specialist pathway. Most doctors from Asia got this one maximum actually.
Hmm.
Those are consultant, like short-term specialist pathway. All right. So then converting into like registration to extend the visa, you need registration to extend the visa later actually. In order to get the registration, you need at least MC1. Under MC1 you can get the limited registration. Okay, so that's the thing. It's under limited registration, then you can just keep extending the visa and all this thing. So this is how the things are there actually.
Okay.
All right.
Okay, thank you. I think I will keep in contact with you.
No problem, actually. Yeah. So, but that is little complicated pathway. I mean, the whole assessment also.
Actually,
I'm sure you're a consultant, so expense is not a matter. But it
I,
approximately costs
I,
$10,000 actually for the specialist assessment. You can try that one actually. There's a person named Anthony, I think Anthony Linuen. Yeah, so he's a bit expert on that, specialist pathway. You can text me. I can give his contact maybe. Um, so maybe he can guide you a little bit more on that, the main specialist pathway. I mean, if because you have MRCS, so you should give it a try. My personal opinion is that as a full um, specialist consultant, you should give it a try. I think because once you're done with the MRCS, actually, all right, that's my point.
will you please give a little information within 1 minute? And I think you have FCPS degree in medicine. So you would try with your FCPS degree at Australia as a consultant. Do you have any idea after completing fellowship in Bangladesh to get job at Australia as a specialist? To share, or if you know.
I mean, some people's story, is it like that, or you are asking to share a story of any specialist or consultant? My question was not, your question was not clear to me.
Actually, my question is, one of my colleague from the Bajipur Medical College, she is at Melbourne General Hospital, I think, and within few days, she told me that after obtaining the fellowship from Bangladesh, a person may have some chance to apply for a specialist pathway. And actually,
Yeah, I mean,
you
whoever
have
is a
FCPS
consultant,
at medicine.
like, whoever is a consultant is always having chances in Australia. I mean, that's like roughly speaking. In my career, I have seen, if I say Bangladeshi doctors, I have seen 2 Bangladeshi doctors. They got direct, from Bangladesh
Yeah.
going to Australia as a direct consultant. I mean, in my career, I found 2 actually. Like it was direct. Short time, I found many. It's like so huge number I have seen. But as a direct consultant, I have seen 2 so far in my life. One of them has also UK
Actually,
training, by the way. Yeah.
I think it is very earlier to say
Yeah.
in this way.
Let's do one thing.
I think I
I
have
will
to
talk to
pass
you.
my
I will talk.
fellowship and
Uh,
MRCS.
Yeah, I'll talk to you about
I
this
think
one a little later, because let's get into the session actually, because we have a session coming up. So I'll get back to
Okay.
you.
Oh,
I think,
I think I will keep it for
let me give you my, WhatsApp number. Yeah, so
WhatsApp
maybe,
number, email
I
number.
need to, yeah, we'll have little more chat on that one. No problem on that one. Yeah, good
Okay.
luck. All right.
Thank you.
So guys, so thank you so much, Dr. Tanvir. Yeah. Anyone has any other question? This is the last question I would like to take today. Any other? Or we can get back. Feel free, guys, unmute and just, you can speak up. Anything from, I can see some of our class monitors also out there, like Dr. Joe Mans or Dr. Tanzila, anything, any questions? Or okay. All good. All right. Anything from Dr. Pound? Dr. Pound also asked, I think. Otherwise, okay, I'm in touch with them. I think let's get back, so a little bit more. Let me show you some applying website. Okay, as I said, like when main course will start, we will guide you with this full, there's a big thing came up. Also, Dr. Qureshi is more expert on that one, but let me just guide you with few things. Like whenever you go to apply for job, of course, ways are indeed.com. Then there is another website I show you. And also you can directly apply through the JMO campaigning. And JMO campaigning will start in February, the first round, and July is the second round, actually. That is for the JMO campaigning. Now, those of you who have passed now, maybe you can apply for the JMO campaigning second round. Still, you have chance. If you're finishing this test, you can give it a try. And let me, some copy paste few links in the comment section. Maybe um, you can just have a look. I just applied few things. Yeah. So you can see some of the job websites I just have posted here in different territory, because website is a little different. So it is recommended for everyone, even if you are consultant, even you are medical officer, whoever you are, open some,
Yes, yes,
like
please.
sign up first. Yeah, sign up, and then, you can uh, uh, keep applying through those websites would be good, actually. All right. Sign up and keep applying through those websites would be good, actually. I'm just sharing this thing in the Zoom link. So you can just have a look of those particular, actually. But these are more detailing, slides which will come up, later, actually. I think me, Dr. Kurishi, Limon, all are there. Dr. Priyanka, she's a GP already, so she will also guide on the GP way. But anyway, so these are some of that website thing. I'll give you 1 minute of time. You guys can collect those one from the Zoom chat option, this particular website links and the things, and you can update your CV and, keep applying for a lot of hospital, actually. Here is the thing, a tip for all of you, you should apply to some hospital, like, and see, what they said. You'll get idea about yourself. Sometimes, actually, sometimes some hospital or some job thing, they also give feedback that, sorry, your academic, your clinical things are fine, but looks like your academic is not good, or you are academically well, but we feel like your clinical is not good. You'll get an idea, at least in that case, for what reason you're not getting the job and the things. So some job uh, things or HR, they mention it, actually, that, the reason of not selecting. So it's better to get to know, or either, some cases you can assess your CV by some experts, so that will be better, actually. All right. Personally, as I mentioned, a lot of services I cannot give personally because of time issues, actually. So in general, in the classes I came and I give the brief and all this thing individually. CV, even with money, I still don't get that time to review, actually. But many people, many expert, they also review your CV. They can guide you, give you more templates and the things. So about template thing, that's usually not a good idea, because every hospital is different, every territory is different. Sometimes you need to have 2 3 different type of CV. And there is another thing we'll talk in much brief about selecting criteria. Selection criteria is another thing. Like in a, say example, a hospital in a Sydney, you need to see what criteria they are looking for as a medical officer. So you need to update your CV according to that, and you change some words so that make it more sugar buttery for them, and then apply. It creates more chance. That is one of the reason I don't prefer too much into template thing actually. Yeah, any standard CV you can make. That's a very normal thing, which we will tell you in the coming courses. But exactly one template you should not follow. That's in my opinion actually. All right, so this slide is quite long, like star approach and particular few things. We'll talk about those things later. That comes as a second part or third part usually during the courses. Dr. Qureshi will guide you more on that one, so don't worry. Not really need to update every time, probably every year. Probably I would say every year. But initially when you start, you will understand the process that you're applying not happening. Then you change some things in the CV. You add some CPD, or you add course completion thing, you add a little bit extra and then applying. Okay, well, after getting the feedback, what they give feedback on the basis of, you make some changes. You try to also talk to your some of the friend who applied and got job. So yeah, my CV, this thing I put and then I got job. So this is how the experience. So directly getting a job by fast application is thus very rare, unless you're already expert in this field actually. Because a lot of people we saw that just back we talked to a doctor, of course he has more experience than others. So experience sometimes matters. So those are junior, I would recommend keep working in your CV, cover letter. By the way, cover letter is not required for all state. Very few want to state required for cover letter. So main it is the CV actually you need, and keep working on the selection criteria. Okay, so this is another very, very important thing. In coming days we'll talk about that one. Any questions, any last question from any doctors regarding this? Otherwise, we will get back to our class on this one. Any last questions from the dear doctors? All right. Great. I think, yeah. So this will be the slide and the thing will come up. This is how the slide will look like. Last day there was a slide, I think, child with some cough and the thing we discussed last day. This is how the slide looks like mostly here actually. And we will be definitely covering up certain things for you. And we might need some role players today as well. If anyone interested, can go through more with some of the role play and things like that. Yeah. So anyways, we'll come back and start discussing these particular things. Yeah, it might be a little long day today, but that's okay. I think a lot of you have clarified the doubt. If you're not looking for a class here, then you can also leave the session. That's fine. But if you stay, we'll be really happy. Now we'll take I think 10-minute break, and we'll come back and then we'll start from here. So those of you who are looking for that class, we'll start after 10 minutes. So thank you. We'll come back in 10 minutes. So see you all in 10 minutes. And those of you who are interested in doing a role play, please feel free, mention your name, we will see that actually. Okay, no problem. Some people you can also message me, I'll see and I'll try to help in that way. Actually, it's too many now, right? In Australian side, because I got also anonymous lot of messages and the things. So I'll try get back. Yeah, so let me see, if I can help you guys in any way. Thank you so much, guys. As I mentioned, my WhatsApp is this one. You can text on this number. It is managed by me and my team as well. Yeah, we'll get back in that case to you. Thank you so much. We'll come back. There's a 10-minute break. We're taking a 10-minute break to start this clinical session. Okay, everyone. So thank you so much for joining. We'll be starting in a minute. So let's get going. All right, everyone. So let's get going. All right. Please comment in the comment section if you are ready to go. Great. Now, let's ask me something in the comment section when you are planning for MC2 exam. Okay, so this can be a nice question. When is your plan? If you have a date, you can mention that one. Or when is your plan? I mean, is it a October, November, or is it like a February you are thinking? All right. Lots of dates are finished for this year, I'm afraid, but okay, that's good. Guys, if you are up to knowing, is it like, online or face to face, which one you should choose, please get back a little bit early in our group that we have taken a session on that one. In Alpha 7, it's already there. Actually, you can go and check that one. All right. All right. In 2024 and 23, at least you can mention that one. Wonderful, guys. Now, let's go and start the session in that case. Great, guys. Now, this is the first question. Now, see, today is too early. I mean, for some of the doctors to do role play. Let me try to brief a little bit more, actually. And later, if you want some role play, definitely we can get back to you on that one. All right. So let me try teach you some cases here, and let's see how it goes. Then we can start the role play. Definitely first 1-2 classes we don't do much role play because a lot of candidates are new, but certainly our candidates can start doing more role play in coming days, actually. But you are more invited anytime if you feel so. Now, coming back to this question, let's try seeing this question, and you can also give me some differentials altogether. Okay, we don't mind. Um, Great. Now, a mother brings her, guys, let's focus on the case now. A mother brings her 6-month-old baby to your GP and having diarrhea and the vomiting. Instead of diarrhea, vomiting for 2 days, decreased appetite, these things. Some examination findings are given. Diagnosis and DD, these things are mentioned. All right. Now, what do you think? What can be the diagnosis in this case? Any guesses? Now, when you get back to the history, as a history, I will also add few things that there is consecutively diarrhea with no blood. Okay, giving you some history, like no blood in the, and there are like particularly episodes like 5-6 times a day. At the same time, vomiting is also going on. Like, example, say I'm a kid's father, I'm just mentioning few things, or some kid's mother mentioning these particular things. Also, at the same time, when you take history, there will be some fever will be mentioned. That is, this kid is also having some fever, or Paul is having some fever. Say yes, so fever, then diarrhea, then this vomiting thing. came up in front of you. And what is the next thing? Next thing you have to look into the examination, especially the most important thing, if the kid is dehydrated or not, because if several episodes of diarrhea vomiting going on, the first thing should come in your mind is whether the baby is dehydrated. Missing the status of dehydration, fail to assess the state of dehydration, you might fail the whole exam. Okay, so hydration status is so important here. Now, how to assess that hydration status? I know you can also mention and you can unmute and tell guys, let's take it more as a learning class. So you can unmute and also add, what do you think? What are the hydration status you should quickly check? Or you can also write in the, if you're not comfortable mentioning, you can also type guys, but feel free to unmute and also talk. It would be faster. Okay, so gastroenteritis and there are dehydration status. We can see here alert, reduce the skin target, CRT normal, mildly shrunken eyeball and all these things. So there is kind of like a mild to moderate dehydration is there, right? Some mild to moderate dehydration is there. And it is very important. If management is us, you also need to correct it. If there's management us, you also need to correct that one. All right. So let's move forward to a little bit and see what came up. Normally we'll do role play. Don't worry on those things actually. So diagnosis gastroenteritis, so fever, then there is this diarrhea thing goes on, and some few things are vomiting. Maybe it's something or something has entered. So also please note that travel history. Do you think travel history is important here as well? What do you think? When you take a history, like have you given something unusual to this kid? But with a 6 months, it is very less chance to go unusual. Mostly they're breastfeeding, but since weaning periods can be at the same time, but there's a high chance that they were traveling. So traveling history will be very important, especially these gastroenteritis cases, right? That is a possibility. Or another point is there anyone in the family is having similar symptom? Is it important as well? Is there anything in the family having similar symptom? Or is this child is going to the daycare as well, actually? And in this daycare, is anyone is having the same symptom? Right. So these particular things you also need to cover at the same time. Last day, if anyone is having first class today, please check. We have taken a history taking class, which is already there in MC clinical, Alpha 7 group. Already it is given there actually. So you can go and check that one. How to take a pediatric history if it's the first class with us today actually. So we have already taken that particular part, like how to take a history in pediatrics actually. All right. Now it is gastroenteritis, so certainly, binds and the topes. Birth history you can ask, but it is very shortly of no use in these cases actually. But if it's a like some developmental issue cases, then your birth history will be so important, right? But so case wise, these are important. Sometimes you can ask questions in compilation actually. Is there any abnormalities in birth actually? So say no, you don't have to get back more, like was there any ICU admission, this, that, which we ask more if there is any abnormal anomaly suspected in a kid or a mental illness. Then we go and deep down ask many things. Otherwise, it's just a superficial. Any abnormalities during birth, just as a no, it will be fine in that case. All right. So that's the thing. Now, coming to that one, if it's a proper history taking, these are the proper history taking questions. I know you're here, but your child is having diarrhea, vomiting after each feed. Could you tell more about this? Always start with a open-ended question. Actually, we'll come back to that one. Yes, very definitely. Vaccination is definitely very important. Actually, vaccination is also very well done, doctor. Now, few things, because it's a compilation of the case of diarrhea, vomiting. You can ask about any one of them. So if the vomiting is forceful or this, that, just to rule out, anything not related to vomiting after each feed or not actually. So it is no, not projectile vomiting. If projectile vomiting, then what? Then we'll think about pyloric stenosis. Now, a lot of cases we got in MC exam with pyloric stenosis. So when said not projectile, that's out of the option. After each feed or not. After each feed means, see, I'm trying to exclude a lot of negative history. You should all start working on that one, because one is a straightforward format, one intelligent question by ruling out the negative things. After each feed, I'm indicating towards esophageal atresia. or dehydrated lactation. After each feed, there will be like, vomiting, right? So this is one of the things. Then of course there is color and all this thing will be asked. Any lump after the vomiting, so this is another thing. Associated with loose motion, with fever and abdominal cramp, they'll say yes, that's like a point actually. Any color changes with the stool, or it's like mostly water, is mostly smelly, no. So ask the question as a like a yes no would be more better in that case. Okay, so that's another thing. And any family history, similar conditions like that, if pyloric is done, rule it out in that case, because pyloric has similar family histories, or anyone in the family is having a similar situation like this, diarrhea at least. So they'll say no, actually. Any concern about his growth and development? Not really. Anything, was he having normal birth and everything good at birth? Yes, all good. He's a happy child, nothing to concern in the family, right? No. Like, so bring those answers as a yes or no. Now, very, very important, because you want to check the hydration status, number of wet nappy. I repeat, the number of wet nappy. What is its significance with number of wet nappy? Anyone, guys? What is the significance of number of wet nappies? Because normally a kid is having a particular number of nappies, but when there is dehydration, so number of nappies will be reduced here, right? Like, so sign of dehydration, right? So number of wet nappies. So previously how many and how many now, actually, because kid to kid it may vary. So how many previously, how many now? So it will be a sign of dehydration clinically when you are asking. And have you noticing any shrunken eye and feels like the baby is eager to drink or stop drinking, something like that? That means you are asking a dehydration relevant question. Whenever they said the wet nappy, the next question you ask that one. Okay, is he sleeping well at night, or anything association like cough, shortness of breath, noisy breathing? Now this last line is very, very important, guys. I'm telling you this thing. Any cough, shortness of breath, and noisy breathing, very, very important to rule out a lot of differentials. Shortness of breath, lot of croup, or those type of feature. Noisy breathing is again that croup, stridor, or bronchiolitis, those particular thing, or even anything related to asthma. Or any cough, it still include viral cough, like, or a pneumonia or anything. So this all thing will be ruled out. Maybe I would say, like, any cough, any shortness of breath, any noisy breathing, or any rash. Rash means again serious disorder that should not be means meningitis. Okay, so just take it in that way, just to be sure that the baby is not suffering in those unusual things actually. And this will carry extra mark actually. Many people fail because they don't ask in this way actually. They just try to follow a typical academic format. It's not like, so you need to bring out, then keep thinking about that 4 or 5 differentials, and you should try include those questions in the history taking as well. And then the stops and the binds, if you remember, like, I want to ask few doctors, like, what do you think TOPS includes which things? Can anyone unmute and tell us actually, like, TOPS means, what do you think? Actually, this is a mnemonic actually. So finally finished with these TOPS and the binds. So what is it, guys? You need to be faster, so that, I can be a little faster. Anyone? Unmute and tell, guys. It's about confidence, guys. You all need to open your mouth in the main exam. Anyone? Dr. Zarin, can you little bit guide them? Yeah, maybe.
Yes, doctor, I know what BINDS is. That's birth, immunization, nutrition, and developmental history. I don't know about TOPS, I'm sorry.
Okay. Yeah. TOPS came in the first day. Anyone remember the TOPS actually? T stands for the travel, definitely.
Dr. T for travel, O for occupation, P for pets, E
Pets,
for
yes. Exposure of
exposure to
those
allergy, and
okay.
S.
So social connections, smoking, anything you can ask actually, TOPS and the binds. Well done. So it's just in general, always you don't need to ask every single. Thank you so much, doctor, for bringing that. So always you don't need to ask. So we just remember in that way, we are not missing anything. You see, uh, if you remember only binds, then this T stands for travel. If you miss that travel, will that a good sign here? It's not a good sign actually. So this will give you a little time to think in the main exam. Top side, do I need to ask about traveling? So any particular travel history, and then they might say, yes, we have recently been to this particular area. And after that, this thing has happened, and some people in the family is also affected. Okay, thank you. Some people also mention TOPS and the binds. Well done. Thank you so much, Dr. Husna. You seems brilliant. All right. Now coming to the physical examination. Now, after the history taking, definitely the next important part is physical examination. If you remember, in general examination has 24 points. Plus, please note, in clinical exam, we don't ask 24 points. We ask limited or anything relevant. So normally in pediatrics cases, last day we told, we ask about PICKLED, P-I-C-K-L-E-D-D. So D for this dehydration. Others you know already. So this D is more significant here. Right, this D is more significant here. So PICKLED, also level of consciousness, because so much hydration and losing consciousness certain point, or maybe a rash cases by any chance, actually, like losing consciousness is important. But level of consciousness is active, happy, and playful, actually. Level of dehydration, is, you can also ask, actually, because it's related to examiner. Now here is a point. If you see our last test video, these things can be whole different in online based exam. In online based exam, you will be just given this slide. In 4th minute, the whole thing will come in your screen. Okay, and it will be mentioned in the question at 4th minute. There will be a prompt, and physical examination will be in your screen, actually. So physical examination, these findings will directly come in your screen on 4th minute. You don't have to ask the examiner separately. Now, dear examiner, may I know the physical examination finding, starting with general examination, and to know about the pyloric clubbing, if present, negative, like any lymph node enlarged, no. What about edema, dehydration, sign of dehydration present, and to know about the fontanelle, and to know about the any Shankenitis, yes, any Shankenitis or any bulging or any depressed fontanelle, yes, present. Actually, you can move forward. This move forward doesn't mean you skip the whole examination and forward to the next step now. Like it means like you can move forward to the just immediate next task. Actually, immediate next is means that more things remaining, or they can tell you move to the systemic examination, move to next, actually they mean to say. Then is there any growth chart and development chart available? Some cases it is available, or they might tell you it's available and it's normal, you can move forward. Thank you. Then more things like vital usually is something we ask. See, if it's a chance of diarrhea dehydration case, in the beginning when you enter as an ID check, like in a DDR examiner, this is my ID. All right, now when you enter, like, hi, I'm Shahriar, one of the medical officer in this hospital, and then you turn to examiner after introduction, that, dear examiner, I want to know about the vital of my patient. Okay, starting with the temperature, pulse, blood pressure, respiratory rate. Then examiner will tell you those things, and also I have to know about the dehydration, because here dehydration is also important. Actually, it's a mild sign of dehydration present. The doctor, I'd like to give him some oral fluid or IV fluid, depends on, it is mild to moderate dehydration, actually. Okay, how is my patient is doing? Can I continue? Yeah, you can continue now. So that's how we start. And please check the question whether any sign of any dehydration or the sign of any emergency is present. Then you have to give that management. Some cases patient is in pain, dear examiner, I want to give my patient some painkiller, some ibuprofen. I want to give my patient some painkiller, morphine for his chest pain. um, and before that, you also need to ask the patient about the allergy, that before turning to examiner. Hi John, thank you, like so before, you must be in lot of pain. Can you scale your pain in 1 to 10? I'm just talking about some other case, 1 to 10. They'll say, yeah, I'm feeling like 8/10. So I think it would be okay, right, if I give you some painkiller, do you want some painkiller? I say yes. Before going to my examiner, I have to ask, do you have any allergic with any drugs? I say no. So then you turn and then ask. If you fail to ask that allergy, your points would be cut in that case, right? Last week we talked about these things. Please check those things in the last video, actually, which we posted in Alpha 7 group. Now coming to this one, there's physical examination things, and keep asking about now systemic examination. These vital things usually ask in the beginning, and later, when we start the physical examination, we can just ask, dear examiner, is my physical examination finding is or the vital findings is same as before to continue. So this is how the conversation happens. All right, some other day I'll show it with, like, I'll invite Intessar. He's Aussie born, so his accents is more like Aussie role player. So you'll enjoy it more actually someday. Okay, great. Now, in the systematic examination, I know you need to find out what system it belongs to mostly. This was a case related to GIT. So more focused examination on the GIT. So GIT will ask about inspection, palpation, even auscultation, and all these things would be related, right? And other system, just superficial, nothing abnormal detected, nothing abnormal detected. Superficially, one two thing is heart sounds are audible, first and second hearts are audible, any abnormal sound like murmur present, negative. Okay, then neurological, any motor sensory or any kind of nerve findings, negative. Look, this is how we proceed actually. It doesn't take much time, to be honest, actually. But some people, want to ask so gracefully, dear examiner, may I know, so that that might take away a lot of time, so when you come to examiner, you don't have to be too much formal, be quick and all this thing. Try to be a little formal with the patient, that is fine actually, but with the examiner you can fast forward, that's fine. It's about getting that information from him. Now, showing something, especially this part has been taken from the John Murtagh patient education. I hope all of you know that John Murtagh has 3 volume of books. I mean, not the main book. There's another is a practice tip, and another was a patient education. This section has been taken from the patient education part. Physical finding examination. So importance includes, this is how it was given. Physical examination can be helpful to determining etiology of gastroenteritis, assessing the presence and degree of dehydration, temperature, blood pressure, pulse. So his pulse and temperature can be little affected. Temperature might be elevated because it is gastroenteritis. We already mentioned temperature elevated. Now, bowel sound can be increased. Did you know bowel sound can be increased in gastroenteritis, guys? Did you know bowel sound can be a little increased in gastroenteritis? Yes, because the motility increased because the bowel is going a little bit more faster, right? So it's obviously bowel sound will be little increased actually. Okay. After surgery, normally which is absent for 24 hours, here it's opposite. It's like reverse actually. Okay. Physical examination clear. This whole part will be given in directly in your screen, just to show you that how it goes actually. This time we might also introduce some mock test as well. Let's see how much time I can get actually, but very limited actually. Maybe once in a week, one test actually. Yeah, that will be separate, like not with the course, of course. Yeah, maybe those finish the course with the previous batch, maybe you can apply for that one actually. Okay, immediately we can't promise you, but you have to take a date in that case. Okay, now coming to that one, what was this case is about? This case is about the gastroenteritis. Why? Because there is fever, there is um, some vomiting episodes, some diarrhea episodes. At the same time, your kid is showing sign of dehydration, and this is probably entered when you guys were traveling, and some bacteria has entered and affect the colon. See how I said to the patient actually, I mentioned what is the main cause, why it is happening, and from where it also came up. So as a compilation, when I said that, gives more marks here actually. Okay, so most of the children, I mean, but you don't have to worry, like address by name. But Melissa, you don't have to worry, this is very much manageable condition, situation totally under control. Now that gives the assurance. All right, and I can assure you this situation is under control. It's very mild variety, this can be managed at home. Okay, so please understand this one. If it is a mild dehydration, can be managed at home. If it's a moderate to severe dehydration, you have to hospitalize. I mentioned in the first class, the need for hospitalization, you always need to clarify in the question at the end. That carries a lot of mark. Not admitting, also mention it if necessary. And so this children, your kid, we can manage, it can be managed at home. You don't have to worry. It's a very mild case. It happens with the kids all the time actually. All right, so no special drug at this problem. Or they might ask, okay doctor, you are not giving me antibiotic. No dear, for these cases you don't need any antibiotic actually. He will be fine with time. We need to provide him plenty of fluid, but all you need is to give him plenty of fluid. That's his only treatment. And keep continuing with the breastfeeding, and we can also add the gastrolite or ORS solution. That's all actually. Right, now let's coming to this particular part. Yeah, So loss of fluid should be corrected. This section has been also taken from the John Murtagh. This patient education. Some points are given like continue breastfeeding, this, that I just have mentioned actually. All right, and come back or consult your doctor. You know the red flags last we mentioned. If diarrhea is not controlling well, or diarrhea increased, vomiting persists, situation does not resolve, the pain increases, and the conscious level started deteriorating, then quickly come back to us actually. So that's like, you have to give the send before sending the patient. More information about little bottle feeding and some of the other feeding are given here, because the mother's first concern is what they will give the kid as a food actually. Okay, so this is one of the thing. And yes, so symptoms of mild dehydration, I know all of you know these things very well, but in exam still people make mistake. In spite knowing, they make mistakes actually. So see, an error, let me tell you, which I collected from handbook, um, fail to assess the dehydration and correct it, and also fail to admit to the hospital. I mean, you don't mention that one, you fail the whole case even though your case was good. Okay, so even though this case was not a difficult one, but just because lack of presence of mind, lack of approaches, you can fail the whole case. Okay, so please find out always from the question and try establish, is it a mild and moderate? If not sure, ask the examiner again. Be sure about his state of dehydration before commenting on the main treatment, because moderate to severe dehydration you have to treat in the hospital. All right, so this is one of the thing. Pattern of question, then there will be some mother's question at the end. Normally, when you said like, okay, history, physical examination, and diagnosis DD, this was your case normally. So let's check the question properly. Is management asked? Is management not asked? Or either they will give you a little longer scenario, means history, you don't have to take, you are mostly have to take diagnosis, DD, and management. It will be very clearly mentioned in the question. But many times mistakes happen. You don't need to take a history. People start taking details history, and uh, lack of, sometimes they might tell you, examiner will give you hint, doctor, stick to your task. Always remember, if examiner said stick to your task, means either you're running short of time or either you're going in a wrong direction actually. Okay, now patients parents question, oh, this condition is serious. Not for now actually, but can be serious if you don't take proper measurements, especially if you don't rehydrate properly, in that way. But at this point, I can say you don't have to worry. Can be managed at home? Yes. Then when it can be, it's solid, usually after 24 hours. Thank you for asking this question. Sometimes, tell one, two nice words. That's okay. Is antibiotics necessary, doctor? My next door neighbor, his kid was sick. He was given antibiotic. And in my case, it is not. So probably his case was different, and maybe there was some different bug which was positive. Probably that's why that case was given antibiotic. This is a case where you don't have to worry. It's very normal actually. So it's probably because of a virus, rotavirus. So probably you don't need it. So since this can be related to rotavirus, do ask about the vaccination in the binds and the tops. Okay, when those points were there, binds I for immunization. So do ask about, is your kid has been vaccinated with some vaccines like rotavirus. Actually, it's important. Can I give cow milk now or breastfeeding? For now, no, but later you can give fluid for now actually. All right. Then the feedback comes as a approach, examination, investigation. We give you feedback and all these things. All right. Then finally the treatment. So depends on the task. As I mentioned, those of you are attending first time, maybe you're not understanding these parts. What do you mean by task and how the marks distributed? Please go and check our YouTube video, or the recording of the Facebook one is also given in our group. You can please go and check that one. Right, so after this there will be a next case that will be coming up, will be this one, but at this point we will take a 5 minutes break and we'll come back. I think after I think after 6 minutes we'll come back and resume the next case. Is that okay for all of you? All right, all good? Mention in the comment section. All good. Any questions from this section? Feel free to ask me. let's patch up this case and then go for the next one. Let's patch up this case and let's go for the next one. Actually, feel free to ask me any question regarding a child with vomiting, especially this was a case related to gastroenteritis. It was a mixed up of a loose motion and vomiting, because gastroenteritis can come up this side or that side, right? In any way. Any questions, guys? If no question, then no question, please write it in the comment section. I just want to be sure that you're understanding actually. Or you can write all good. All right, I can see some of you are there, but okay, all good, great. Wonderful, guys. All right, so we'll take a 5-6 minute break here, guys, because I've been talking for a while, and then we'll come and start this case. You can keep thinking, but we will be taking a 6-minute break, but you can keep thinking about this one. Okay, everyone. So let's get started. Yeah, sorry about little break. Yeah, because we had a double session today. So the first half was how to search for a job. I hope so you got basic ideas on that one. And later we started the class actually, so initially we done that initial one. Is it understandable, guys? Is it looking so difficult, MC2? Or do you have that belief that it can be done actually? That's most important. So when you start believe that it can be done in a single go, that's all you need actually. Okay. Coming to the next one, as we said in first 1-2 classes, we are doing less role play, but if anyone wants to do, we'll ask him definitely at the end. Okay, now here is the thing, like, you are a GP and mother brought 4 weeks baby and saying that child vomits after feeding, has gone put 1 kg and there's no other symptom. Mom thinks that bottle feeding will better. Now, this question, by seeing it, has a very less information in a case like this, and that means you have to ask a lot of thing in the history, and by history a lot of thing will be coming up, right? No need for further examination required. It might be given as a prompt or any other thing like that. Diagnosis and the management. Now let's go into things. Let's see, this is how the role player will start actually. Hopefully from next year, we'll close that group and you will do video role play with us. Today maybe the security many are not much interested coming for role play. Now let me give you idea, like first, what do you think? So she says child vomits after the feeding. It can be anything. It can be pyloric stenosis, it can be GERD, it can be anything. Little bit examination finding here, just to give you guys idea. If it's a online based exam, you will be given as a prompt, and in the prompt, as a 4th minute or 3.5 minute, whatever, it will pop in your skin like this. All right. So like as you can see, palpable olive shaped mass and visible this thing and sign of dehydration actually. All right. So this particular thing. Now, what do you think about the diagnosis now? Now, what do you think about the diagnosis? Does CERD or gastroesophageal reflux disease has olive shaped mass? A very quick question. Do you think this particular olive shape, is there any olive shape mass? No, not really. It doesn't actually. So this is a very important finding that, is there any mass? You can ask that one even in the exam. A very, very important that, if olive shape mass or there is yes or not. If mass, yes, that's high chances this is pyloric stenosis. All right. Now, coming back to this question, I mean, this question is based on history taking, a lot history taking. Now, in that history taking part, as you can see, like normally it's a vomiting related question. In the very first class of history taking, if you see, there was a particular some questions for every vomiting related cases you have to ask, if you remember, like when it started, color, a lot of things, right? In the first class. Those of you who missed that class and joined just now, please go and check out that particular section on how to take vomiting histories. But this is more specific in general as a feedback. As I said, like not much people are showing encouraged to come for role play among the new doctors, but surely I'm from next class, we cannot force them, but hopefully from next class they will start coming. Now you see this, like when you start role playing, as say I'm the examinee and entered and role player is sitting, like we start asking, can you tell more about this situation? Before that, I will introduce myself as my name is Shahriar, one of the junior doctor in this hospital, or I'm a GP in this clinic. How can I help you today? Tell me more about what brings your kid in this clinic. Actually, tell me more about Paul, or you can ask what is his name? Okay, it's his name is what is your kid's name? It's Paul. Okay, that's I must say it's a lovely name. So this is a way of good rapport development and communication. Can you tell me now more? Like what brings this lovely boy Paul in this hospital actually? So this is another more interesting. You can make it more interesting. Now, when did it started? How many time? Then is it forceful or not? Now, if it's forceful, yes, that means 1 point towards projectile vomiting. So that means it can be pyloric stenosis. Now, relation with the vomit to the feed, yes, so they will say yes. And how long after feeding? Immediately after eating, doctor. So, did crying? Yeah, he's been crying on and off. Before vomiting, does the child cry? Not really. He said. So does the legs up while crying? No. Yeah, that goes with some seizure related thing. Okay, not related to that one. So this is a one of the negative history. Like, this is in many institutional note. You will see these things are not there. So you need to understand why you are asking that question. Draw legs up while crying. So because that's a ruling a negative history. Now, have you noticed any change in the motion? No, doctor, just stool is passing, no stool pass, sorry, no stool has been passed, what we have noticed. Um, does the child feel like eating according to you? No, not really now. Any abdominal distension, and this is very much yes. And if there is mass, yes, doctor, like, so they're good actors, so they will come up with more nice, acting skills and all this thing. So, did you feel any mass or swelling in the abdomen? Any particular? Yeah, I've seen, this particular in the tummy, there's a mass. Okay, any fever? No, and you didn't notice. And this last question, you need to get familiar. The association, any cough, any shortness of any noisy breathing, any turning to blue, any rash? No, doctor. Okay, so that means you are excluding a lot of negative things. Other differentials, please remember, you need to exclude in the histories actually in a smart way. Okay, how many nappies per day? Because ruling out dehydration status very important, right? In every cases, particularly in kids cases. How many using previously and how many now? Right now, yeah. So this is important. Any color change in the wet nappies? Ask bit about the obstetric history. Has this thing present in the family? Is this question is important for pyloric stenosis? Is this similar kind of situation is present in the family with anyone in past? Is this question is important for pyloric stenosis? Let's see your ideas. Does pyloric stenosis has some family history? My quick summary question here. Yes, it is a risk factor, definitely. So for pyloric stenosis, there is possibility of that family history. All right. So yes, male child, firstborn. Yes, well done, doctor. Okay, so again, lastly, finish your case with a bind. So have you used any recent travel history which I know about, any pets or any exposure or any smoking? Can you tell? So they will say no, negative for that. Any bad obstetric history, like, birth history, I should know? No. Immunization up to date? Yes. Nutrition development you're happy with? So far, I'm happy. Anyone smoking in the family? No. Anything unusual in the family that I should know about? This is an indication towards a child abuse or things like that, just for security purpose. All right. So these are the certainly additional things, you can ask. It does not take too much time, to be honest, in the history. Start learning how to talk confidently and how to, some people like, see, I'm talking quickly, but probably does not show too much that I'm going very quickly with some of the words. So it has to be, so your word punctuation has to be also like clear cut. Some people, when they try to go quick, because of word punctuation is not similar for all doctors, it looks too hurry. Okay, so but sir, on and off, you have to speed up at certain points. So please make sure it does not look too much hurry up in the main exam actually. So word choosing is also important. Compilation of word is also important, so that it does not look too hurry in the exam. Risk factor, like, male, firstborn, parental, this thing. I knew a friend, he was using this technique in that way. Say less time left than to John, like, in the history says, John, uh, I'll be little quick now because I have less time. Uh, it was accepted actually, so this is one of the thing actually. So that few question he went. So the next person, if hour that you are going to ask few quick questions. So John, I'm going to ask you quick questions because I have a little less time. So I wish we have more time. So then you ask some quick questions. So this is another way. You see the approach little different actually. So it's all about approach. And last point was here as a family actually. So family is important here actually. Coming to the things, last I told like a lot of things in pediatrics, especially the management portion, no matter what is given in our note or not, I want you to open the RCH guideline once actually, because RCH guideline sometimes changes even in a month sometimes actually. So, you just need to keep checking them actually, especially. So fluid management is stop oral feeding, obvious reason because some obstructive features. So you stop the oral feed and insert nasogastric tubes if profuse vomiting is happening. All right, so this is the thing. And how to manage, what type of fluid, these are given actually. And you monitor with, repeated blood gas. So if there is option of investigation, so blood gas, electrolyte, these points will be also, you can add here actually. Now, few things will come up later actually, that what is the management actually. I'm telling in generally to all of you actually, because main exam will give you like a 3 or 4 segment, not like history, physical examination, investigation, diagnosis, DD, management. Everything does not come together actually. Either it will come as like a diagnosis, DD, and management. It will come as a history, physical examination, diagnosis up to this. Now if it comes as a management, now you have to be careful. And last day I told, like drawing might, a little bit increase your points. So you try to draw a little bit and make sure you make them understand, like pyloric, stenosis, like this part has, see, this is your stomach, this part stenosed. Now you talk to the person, like, with that history and the physical examination, we think your child is having a condition in the stomach, like, which is called pyloric stenosis. Have you ever heard about this one? No, never. Now you draw a little bit, this is your stomach and this part has been stenosed, and that's why the foods are coming out forcefully. Actually, now you understand? Yeah. And explain them what is pylorus, what is this, that, and this might leading to a symptom like poor weight gain nowadays actually, whereas in GERD has a normal weight gain. This is a very, very important differentiating factor, guys, actually. So whether gaining weight or not, this is very important. So there can be symptom like poor weight gain, or GERD has a normal weight gain. There's another point I like to add here. After vomiting, baby remains hungry. This is related to pyloric stenosis, or this is related to GERD? Just clarify, guys, in the comment section. After vomiting, the baby remains hungry. Is this related to pyloric stenosis, or is this related to GERD? Answer in this case, this is pyloric stenosis. So this question definitely will bring up again. Okay, it is also very, very important. These are the points you are ruling out the things actually. All right. So now you come to the point mentioning him whether hospitalization is necessary or not, or that particular important point, assessment, is it a emergency case? So this is a, my dear, this is emergency vision, but don't worry, we're with you. We have expert team on that one. And I'd like to add that operation would be required, Melissa. You show your feeling in that way. Operation would be required actually, that you feel sorry, you show in that way. Rather you say it's an emergency situation, operation would be required. Right. See, the both approaches are different. um, Melissa, this is an emergency situation. I'm afraid its operation would be required in this case. Now, this is like, the approach of talking, it makes a lot of sense actually. All right. You have to be a good actor in these cases. Now, so this stage, make sure you don't give anything oral. Please make sure on that one. And definitely we need to admit. Patient might ask, hospitalized. Yes, I'm sorry, but we have to admit Paul actually. And don't worry, you'll be seen by a very expert registrar and consultants um, in this case actually. Then more questions will come up. But before going to that one, every cases, last day I told that how many differentials in generally should be in your head. There are at least 5, right? In a standard, like at least 5. Actually 4 can be also okay, but standard at least 5 should be keeping in mind. All right, and you do ask some questions related to exclude that at certain point in the history. Now, what you like to do is go for with an ultrasound to confirm further, and if dehydration, of course, will get to know if it is present in physical examination, you give IV fluid. Okay, so if the cell keep vomiting in, we have to make sure there's like surgery and things are done. So let's coming to that one. And rehydration, please do mention that, at this stage rehydration is very important because the baby is showing some sign of dehydration actually. Now later few things will come up more about the surgical talking. Is it a safe surgery or not, and this, that, they might ask you more actually. So this is the note section we provided, and also some other things also provided actually, so stenosis and what to tell. Now, this is another important question I've taken from one of those, I think from Karen, that this question often asked by some of the role players. Can it happen again, doctor? So you said, unfortunately, this thing can repair, but the number is very less actually and rare. All right. But still, I would recommend you the surgery in this case. All right. So this is how, you should go through these particular things. Just taking a second. All right. All right. So whenever, you learn few things, oh yeah, like, during online exam. Okay. Now you take a piece of paper. Say example, let me show you. If there is like a piece of paper, all of you, I think, did you attend the last day class, my dear Dr. Asima? Did you attend the last class yet? Okay. I think in the last class, we also mentioned about that one. Drawing in the online, say you have a pen and you have a paper. Okay. And you have a A4 size paper. In the beginning of the exam, you have to cross check in front of the camera that, you have a piece of A4 size paper. Now you can draw a few things there actually. Okay. Now in that A4 size paper, you draw a picture of a stomach. Okay. And then just trying to show, see, Melissa, this is your stomach and this part is constricted. And that's why any food you are giving from the upper side through the mouth, it's coming up actually. It's just that's that one. But you are trying to give effort. That's all they want actually. They're not going to see or judge you on the basis of drawing. Is it clear? Is it like the effort you are giving? That's all they want to see actually. So try remember every points actually. People, what happened, in exam hall, people get puzzled. All of you get sometimes a little puzzled. So you start forgetting the simple things like there was a drawing thing even you might forget. So this is the thing you all have to practice in these coming days actually. Every this single point, even some people one of the doctor, I was doing a role play, forget to introduce herself actually. Hello, what brings you today in this clinic? So later I also laughed that, doctor, isn't it you should introduce yourself? Oh yes, doctor, I forgot. So see, you all know what to do, but sometimes it's just early days actually. So please make sure, did you have a study partner? I'm sure you passed the MC exam and you do have a study partner. Now if you want to start something, actually it's two way. Okay, one, some people are joining us, they start our notes already. Okay, so they'll start seeing notes and okay, and let's come and start doing role play. This is one way. Now what if you are still haven't joined or planning to join little later? Handbook, last day I also mentioned, handbook is not a good choice. In my personal opinion, it's too lengthy and we don't talk in that way in MC exam hall. So that gives sometimes of, false positive, idea. Okay, this is how, okay, they start memorizing. They don't understand, then they start memorizing. So ideal would be, if you want to start little later, in our academy, there's a one option is there that you can take away the recording of any of the current batch. You keep checking them and later join for the live actually. And every day, one or two cases, if you can do from the recording, make your own notes. By even if you're joining after 3 months or after 3-4 months, there will be another batch. So even if you're doing that, by this time, every day you are finishing 1-2 cases. So by the time you come to us, you will be finishing roughly about 100 cases. So total MC is like a 200 cases or 250 cases roughly. So if you're finishing half and can coming and without having much issues, just 1 hour or 1.5 hours you have to spend every day. But never stop learning. That's my suggestion. Your MC1 knowledge will be reflecting in your MC2 knowledge. This is for sure. Now you remember everything. Okay, but after 3-4 months, you start forgetting. Something will come up with your life. People will tell you this, that advice. Those of you are, not having kid, some suggestion, oh, yeah, done with enough thing, now it's the time you should have a kid. It's not bad thing, of course, but I'm sure, I'm not sure some of you are already hearing this or not from other people or not, yes, exam will come, but, kids should come now actually, so many suggestions from the side and this thing you will get to see. Please, guys, remain focused. Some people take 6 months to figure out even that, they should go for PESCI or they should go for AMC Part 2 exam. This is a total wrong thing, actually. If you're confused, at least go for one. Okay, if you're too confused, at least go for MC2. You can take a date and go and appear in the exam. You eventually need general registration to secure a PR, right? This is very common, actually. So those of you don't have the PR in Australia, you don't think too much things, actually. Go for MC2. You have to give even the MC2 exam in any way at certain point, right, to secure the PR. Without general registration, you can't. A lot of facilities you will not get in Australia. Your kids will not get the free benefits, and otherwise things are very expensive, right? If you have to everything go by yourself from your saving. So make your roads more smooth in Australia. All right, enough of the side talking. Let's come to this one, summarizing of this case. In this case, it was a 2 to 6 weeks. All right, so Paul's age was like, so under this, so 2 weeks to 6 weeks, that's usually given in pyloric. Our age is also supporting here. Secondly, in the discussions, vomiting after the feed. So vomiting after the feed, it is pyloric stenosis, esophageal atresia, then duodenal atresia, those all things. So you can also ask at certain point, is there any available radiology for me? If duodenal atresia, let me tell you one thing, in duodenal atresia, they often give you a radiology to you, hand over to you. The examiner will hand over a radiology to you, or in the online exam, it will pop up in your screen. There's available radiology, and you get to see the double bubble sign in that case, right? Then you become sure that this is not pyloric stenosis, this is duodenal atresia. Duodenal atresia from the very first feeding. The difference between pyloric stenosis and duodenal atresia, from the very first feeding, they start vomiting, which pyloric stenosis from the very first feeding, it does not start. That is a differentiation. And of course, the radiological finding. So in this case, vomiting, HV, distension, no fever is important. No fever means not gastroenteritis. Pyloric stenosis was the diagnosis, fluid correction, nothing per oral, and surgical correction. Surgical correction is very, very important. Dehydration and electrolyte correction before the surgery is very, very important. Surgery requires answer to the parents. Parents has a lot of inquiries, including even the procedures of the surgery. Can it be recurrent? This is another popular question. So it can be recurrent. If you can tell as a little percentage, like what is the percentage of recurrence? I think I'm not very sure. First, I told you that one. If you can use a stat, genuine stat, all right. So in that case, actually, you will be given, quite added point. Actually, if you use this stat, like, see, your situation is common, quite common. 7% of all the kids at different time at this age group suffer from diarrhea. I'm just telling I'm not sure about that stat, but if you can use words like that with stat, especially in the explanation and the management part, your marks is going to increase. A lot of these things we'll talk about in coming days. How to improve the marks and all these things. These are very, very important. And please make sure you have your small sticky notes you attached in your wall and all this thing. So example, these are certainly some points. So these particular small things definitely you can write in a small piece of paper and put attached in the wall. Actually, you see every time you remember the cases, then you will not make mistake. Actually, if you think that okay, in like part one you read everything and you don't have that much time to think in MC2, because in under this 8 minute you have to perform and talk at the same time. All right. Okay, so that's the end of that case. Is there any question with the pyloric stenosis, guys? Feel free. Yes, feel free to ask Dr. Husna.
Thank you, Dr. Shahriar. Just one question. The agenda of the patient's mother was also changing to bottle feeding instead of breastfeeding, as I can remember. So do we have to actually address that as well in the explanation, or counsel her about this, or just saying about the pyloric stenosis is enough?
Anything regarding the feeding, see, last question I was mentioning that mother will be always concerned about the feeding. So if you can add anything, like here is a thing, like here initially what we do, initially nothing per oral, but after that what we do, if you can also add that one, that will carry more marks for you. But here it is not much more concern because this is an emergency situation. So nothing per oral and then admitting the to the hospital. Okay, if you would have been sending home, then giving the feeding advices are more good actually. That this is a mild case, so you are taking home, and that
Mm-hmm.
should be your feeding things. At this point, you are admitting to the hospital, and nothing per oral you are giving, because everything will be going by the fluid, right? Because it is emergency. Till that surgery, nothing
Mm-hmm.
is getting actually. So that's why the
Okay, I
feeding thing I didn't
understand this.
bring much.
Yes. Yeah, I
Mhm.
understand it. But in the history, shouldn't we, after, asking the question about vomiting and Boinsma, like ask one question, okay, what is the reason
Mhm.
that you um, want to bottle
Okay,
feed your baby?
let me go back to that history taking. Yeah. Okay. Relation with the vomiting to the feed. Usually, when you're asking question, you can more go for meta-analysis of the question in relation of the vomiting to the feeding actually, or that bottle feed thing. If you want to ask those
Mm-hmm.
things, you can add that one in that point actually. If you want to extend a little bit more, it's
Okay.
it's all welcome actually. Anything that makes your case a little bit more stronger, you can definitely add that one. Okay, always remember that actually. I mean, these are
Mm-hmm.
some of the superficial particular things, but you can improvise it definitely with some more nice points. And this is the thing to learn actually, like, we all get to know from each other these particular points, and from you, many will be also benefited for many nice points actually in that
Mm-hmm.
way, actually, because
Thank
you are
you.
already there in the
Thank you.
system. Yeah. So that's a good point, doctor, I would say. Yeah. Thank you.
Thank you.
Nice point. Thank you. All right, and these are some of the points to be added actually. Just one thing, everyone be careful about one thing. Everything is fine, but make sure your time management is okay. I mean, um, yeah, don't miss anything which is very particular and important, and also be careful about the time management actually. This is also very, very important. All right, so end of that particular case. Now here is a new case. We'll not go for a break now, um, because we will be also finishing soon, don't worry. So here is another case that is given, similar type of case. Mother with a baby comes with this, that, and when you enter into that one, in the history this time, you will find that rather than this vomiting after feed, that's can be there, but they will tell more about the night symptom this time. Now if they tell more about the night symptom and bloating features this time, what it is, it stands for, like when you enter in doing role play, next day we'll do more role play definitely. And then you enter, I said, okay, my kid is having night symptom and is bloating at the night. Okay, and I might say, okay, milk flows freely from the mouth because it's a 4 months kid. So if breastfeeding is done by the mother, like, and milk comes out freely from the mouth, then the diagnosis is going more towards the GERD. Now, we will like to add more point and ask more unique questions in the history, so that, it's become more clear. I mean, examiner gets a more clear view actually. Now, key differentiating point in MC clinical exam is for GERD and pyloric stenosis. One of them in GERD is the normal weight gain. All right, so this is one of the thing, and that poor weight gain is somewhere related to pyloric stenosis. GERD not remains that kind of hungry, and pyloric stenosis child remains hungry after the vomiting. So these are the two terms we always like to include in GERD and pyloric stenosis. I hope I already mentioned that one, but here is in the slide. Now, when you start, like, tell me more about the vomiting, then the patient might tell you a few points. Those are the information patient like, yeah, doctor, don't know what it happened. I'm noticing it for last few days. And at the night time, she's not sleeping. And then you can cut down and ask, okay, do you think in nighttime the symptoms are more? Yes, doctor, nighttime symptoms are more. Okay, please go ahead. And there's also bloating. If she forget about mention bloating, noticed any bloating? Yeah, I was thinking, have it like a general conversation. Yeah. So have you noticed that, vomiting is forceful? No, doctor, I know, didn't notice something. Any mass, no, not. Okay. And he remains hungry after the feeding. In that case, you answer, not really, doctor, actually. Yeah. So it's not really pyloric stenosis. Anything in the family history? No, I didn't notice anything like that. Or, all right. So, we just try to differentiate between this pyloric stenosis, GERD, and also the general atresia, also the gastroenteritis. Okay. These are the particular things we try differentiate in every cases. Okay. Vomiting just after every feed, not every time. Okay, so these are some of the key points for this case. Some of the section this has been taken from the RCH guideline as well, actually. Great. Now, after coming to the history, taking this part about GERD, it is a passage of gastric content into the esophagus, actually. Now, this particular part, I told you guys in that first class that you should make your own notes, actually. I mean, because in the main exam, they don't want rote learning. They want something unique from you, actually. So this is one section I have given things in this way. And in another section, if you see, if I highlight this part, actually, it's like most likely having a condition called gastroenteritis. It happens when the food stomach overflows back to the esophagus. See, this is more easier line, which I created, right? So rather than this line looks more. So you can also improvise your own line. Improvise your own line, actually. Like nowadays, there is, new thing came up like chat GTP. I mean, if everyone heard about this chat GDP, that, if you type something, they will also create something for you. So can you tell why gastrointestinal reflux disease happens? So they will also tell you immediately, and it will be in a simpler word, actually. So that can be another good idea nowadays. Like, you go to the chat GTP and, you ask them that, tell me gastroesophageal reflux. Okay, so and they will tell you in shortcut and all this thing. You can also see it, actually, just an idea. Use the, new things, actually. Yeah. Another thing, normally I improvise sometime uh, while, doing the, fellowship and post-graduation in UK, like masters. And uh, uh, one application that is quite free, that is called paraphrasing tool, actually. Every, this line I take and put it there, it will come up with a more simpler word, actually. So anyone knows about any paraphrasing tool? I mean, those are into the research or publication, they must be knowing any paraphrasing tool. Like this whole word will be changed into a more simple form, actually. Anyone here? No, not really, right? Now, okay, let me type that one. Quillbot. Okay, Quillbot is a paraphrasing tool. You can check that one. Quillbot is a paraphrasing tool. You can just check and copy one section and paste it there, and it will come as a more simpler or a different form. All right. Great. So you can use that. I know. So as I mentioned, rote learning is not a good idea. Even if you are perfect in your case, you might fail the MC clinical exam. Actually, please keep it in mind. That is one of the reason. Still, the fail out there. So this is something we try tell our candidates, and will tell many times, like, how to prevent that one. Tell this thing in a little different way. Tell that thing in a little different way. So this is two technique. Many of the things we'll tell you in coming days. To change the words a little bit, everything, because they're MC clinical examiner, they have been conducting exam since last few years, actually. So, and all the type candidates and telling the same thing. So whenever it's something, someone came up with more confidence and words looking little unique. Yeah. So in that case, they are more interested and they found it is not a rote learning. Okay. So here's few points given, you just check it about, like, smaller feed, lift up the head, popping the baby after the feed, so these particular things are just been given. You can just have a look on that, actually. All right. Reassuring is more important that this situation will be fine. This situation will be, so reassurance is very, very important, reassuring. And you can also give some proton pump inhibitor. This is another thing. If not improving, some other things you can also do, actually. All right. So these are the certain, additional things are given uh, about the GERD cases, because paragastroenteritis GERD is almost similar. So I think nothing much left here, actually. So some more causes about the child with vomiting in general are these are the causes, actually, all these things. So GIT causes, non-GIT causes. If you can think in between them, like GIT, pyogenesis, dural atresia, firstly these three, then comes like the some obstructive, like, like a hernia or intussusception. Yeah, because talking about vomiting. So these situations also can cause abdominal distension, vomiting, these things, bowels and absent. So how to differentiate? You need to understand. So try write DT. This is another practice tip I can give you. Try take a A4 size paper or something like that, and try write the 6 of this disease and try write their unique features actually near to that. So example in GERD, we know, let's try it. I hope you are writing to, let's say, night symptoms. Night symptoms, bloating, baby not hungry, no, then free flow of milk. All right. And you can give PPI as a trial, right? Just reassurance would be enough. Okay. And no hospitalization. If you want to write a note, like a small, like a sticky note like that, this is how this point should be there. Okay. Or you can also add one to unique point if you feel so it is necessary. Same goes with the pyloric stenosis. Pyloric stenosis, like first of all, projectile vomiting. Okay, let's see what's projectile vomiting. Next thing is coming what? Peristalsis, that's a possibility. Olive mass is another thing. Another thing would be dehydrated, which is not dehydrated. Right, learning one point, another one can be added. Dehydration, yes, because vomiting too much. So later IV fluid, hospitalization, these are very important, and surgery. And you can also write the point recurrence. You see, like how I'm writing the points. So every certain disease, if you write and you keep writing some unique points near to this, it will be a very, very good practice for you. All right, clear everyone? Hope you like the ideas. Yeah, so I'll try to tell you this particular things by writing, hopefully next time, but you should also try particular things by your own improvisation will be important. So any A4 size paper, if you take and write these 6 diseases and try writing over each other. This is a very good practice, I'm telling you guys. Okay, this will extend your memory. Then opposite page, if you want to write something extra or additional, like what is ZRD, this simple thing you can also write in a simpler form, your own words. So one page you can write these unique points. You turn that page about that 5-6 diseases. What is ZRD? You write in a simple way. Okay, so that can be done. You can keep a sticky notes, is this okay? You can also keep a A4 size paper, the punch papers. If you take a A4 size paper, you can punch it. Do you know this format? Maybe you have seen it with your father or parents are using for offices. There are like files like that and some A4 size papers. So those extra paper, which you are writing in, if you think this is important later, you can punch it and put it in a punch file. Okay, this is another technique. Technique is important. As I said in MC2, approach is important. For passing, technique is more important actually. Eventually everyone learns all points. But here also keep discussing. That is also very important. Keep discussing with each other the solutions. Like some serious disorders like septicemia, meningitis, please make sure you ask questions like any sign of UTI, any sign of rash. You ask these things. This will exclude some of the serious disorders actually. All right, we're about to end actually. So like 9-year boy with a malaise fever, there will be situations and things can be given as well. Uh, Anyways, you see, these are the handbook questions for pediatrics only. Now, do we have any relevant case? You can see pyloric stenosis, we have a case. So 685. Okay, guys. So can you do that today? 685 page. I mean, once just leave the class, don't leave your desk. You open that 685 page, drop it on your desk, and then leave and go somewhere for tea, coffee. I hope you can do that actually. That's so you can see pyloric stenosis, it is already there. Now you go and see whatever I told. You try to mark this one and things will be much more easy for you. Okay, so this technique you should follow. It will be more easy, more fun while studying all these things. The remaining nothing much to tell here. Yeah. And lastly, there will be something given, I think at the end. Yeah, I'm just trying to take you somewhere. Just 20 is already been through. Yeah, these 4R are important, guys. Refer, red flag, review, reading material. If you're sending the patient to home, please remember, don't forget to mention the 4R. Those of you joining for the first time to this class, please check out the previous 1 or 2 classes taken. One of them was related to history taking. One of them was details discussion about MC Part 2 exam format and which exam to take. MC online or face to face. That discussion is also there. Also, a copy is posted in our YouTube channel as well. Here's a one given like that, a scenario. I just want to show you a little bit on that one. Just give me a second. Yeah, so there's a thing. This one is one of the last case. Actually, all the formats are same now. Whatever the formats we have gone through are kind of same now. Here you will be given a extra thing, which is a two finding. Can you guess what is this? Its name is MC Clinical Alpha 7, my dear. Are you in this group? If not, please search with this group actually, or maybe anyone can share a group link. Maybe because I'm taking class, I can share that link. Okay, my dear. You can search, I think you will find it actually. Okay. So coming to this one that, there's two things I can see. Any guesses what it could be? Working as a like hospital RMO, you have been called to talk to the mother, gave the birth to a baby 24 hours ago. She started breastfeeding and vomiting several times, so looks dehydrated. The neonatal checkup is not revealing any pathology, and abdominal X-ray is provided. Abdominal X-ray is provided. So you can see there is two things in a X-ray. So this is what? This is a double bubble. You can see this is a one like a bubble. This like another bubble. So this is a double bubble side. So you need to explain this X-ray actually to the yeah, and also give some stats. Very important, this kind of question, like 23 literature has also Down syndrome. Okay, so these important stats actually, you need to provide. So duodenal atresia, like yeah, these are the history taking part. After this history taking part, definitely other associated questions, TOPS, binds, you asked, family history you asked, because in duodenal atresia there can be family history as like pyloric stenosis, compare contrast. In GERD, we don't have such kind of family histories actually. Now explain the X-ray like in a structure, black and white, because this is a layman. This part is AR, this part is this. If you explain in that way, it's good. Okay, so food pipe, stomach, intestine, these things, and these two bubble you see, these are double bubble actually, and it is an indication that small part of your gut, which is called intestine, this part is obstructed actually. You don't have to worry, but are you with me now? Sometimes we ask this question, are you with me? It shows that you care for the patient actually. Duodenal atresia means absent of a part of the small bowel, So anyways, you can just see that one. You find your own way. Again, the same thing is the necessity of hospitalization. Answer, duodenal atresia, definitely it is a yes. You have to recommend the patient to the hospital, tertiary hospital, definitely assessed by a pediatric surgeon, and surgery will be needed high likely in this case. So do not feed the child in between this period, nothing probable. If you give food, it might cause more pain and situation can worse the can be worse. You mentioned this one. Otherwise, don't give food. If you just tell, parents don't understand that one. Arrange a lactation nurse, reassure outcome of surgery is good. And what to do after surgery, also all these things actually. All right. So after that, you ask the patient, do you have any other further question? We close the question that way. Thank you for so is this answered all the question? Yes, I thank you for bringing all these things. Do you have any other question? No, thank you. So that's how you close the case. If you also examine the patient, you open the dress, you close the dress. Okay, then you go. That's better. All right. So these are some of the other things. More things we will discuss definitely in coming days. So good luck to all of you. And yeah, so I will start sharing the slides probably from today, and we'll notify in that group section definitely by sending some of the notes and all this thing. I know some of you registered. We haven't sent the notes and all this thing. You will be added to the drive. for the classes and all this thing. All right. So great going, guys. Hope you enjoyed the session. We have covered today two things. One was the what to do after MC1, some job and those things. We went a little superficially on the job one, but I hope so. I hope so you have a clear view at least. And the second one we gone through that, pediatric childhood vomiting clusters. I hope from the next day, my dear doctors, those who have already joined us, will start doing role play with us. Actually, initial days we cannot force them, but certainly from the next classes we can do actually. Our next class today is a Saturday. Our next class would be on Tuesday. Thank you so much. You can give a thank you in in the end. And if you have anything, feel free. My messenger, my WhatsApp. You can come for free, like for advices and all this thing. I'll try my best to answer you back in 24-hour time usually we take actually. All right. So thank you. Hope you enjoyed. And is it too difficult? I mean, before I left, I want to know, is it looks too difficult, MC2? Like I know how people just keep telling that, oh my God, like it's not possible to pass. Was there any information that I gave was looking too difficult actually? Yeah, our classes are Monday, Saturday and Tuesday basis. Yeah, definitely we will be providing you the schedule. Actually, initially we'll finish the pediatrics and simultaneously medicine will start. We'll give you the schedule after talking to Intesar. Actually, Intesar will come up for Intesar is working in Australia and he's an OZ, so that's the thing. Our passing rate is good, so we don't have to worry. Our passing rate is 75%. So we believe on that one. Our MC passing rate is also 90%, part one. So, but original passing rate is like, very low, like 40%. So it doesn't really matter actually, it's about confidence. Now, is it doable? It's doable. If you go tell why you fail actually. And, when we get feedback from the candidates, they also say like, it's good actually, yeah. Intesar will come. Intesar passed actually 13 by, I think, 14 station. Ornob, I think, cleared almost 14 station. Henny cleared 13 stations. So even those candidates who have gone through the academy, they also cleared, almost all lot stations. This is also very important. Like, last thing to finish with, why don't you target passing most of the stations? Okay, rather than just thinking whether you pass or not, why don't you target most stations? Actually, there was another Dr. Ifat was there. Dr. Ifat passed actually 14 out of 14. So I think many I know from the academic students, they cleared the 14 out of 14 students actually. So you can actually do that. Actually follow the formats, follow the advices, keep going with the flow of the classes. It can be done. Okay. In MC2, our approach and MC1, our approach has a particular little different. In MC2, I focus more on the technique, more on the cluster. In MC1, no one is more updated than me in MC1 in terms of the recall. You all know that. Okay, how much recall we put effort actually, because MC1, this particular recall thing so much matters or not. In MC2, recalls definitely matter, but your technique is number one. Remember this last line actually. Your technique is number one. Any vomiting cases comes, if you approach in this way, you will definitely pass actually. Doesn't matter it came what fraction in the last month or not. If you follow this approach, 100% you will pass actually. All right. So thank you. Good night. And a bit long class. It can be done actually. Yeah. I mean, you can pass all these things. Definitely. You will. I mean, why not? Why not? You can be the one. Definitely within a 14 by 14, someone is mentioning. Definitely. Good luck. See you all. Actually, I will post the class recording after some time in this group. And soon I will start adding to the drive where you will start getting all the recording. Today's class one, I will post in the both groups, guideline group and also our Alpha 7 group. If anyone not added to Alpha 7 group yet, dear class mentor, maybe Dr. Tanzil or Dr. Joe Mats, you can share that Alpha 7 group link here. Maybe those of are not added, maybe um, they can be send request there actually. But it's easy. MC Clinical Alpha 7. If you just type with this name, you will find it very easy. Thank you. And you can also attend one more classes. Next class, you are also invited. I think this whole month you will be inviting everyone. So if you have friend, you can also invite them. There's like 2-3 more classes will come up. You all can attend actually. So feel free attending some of the classes in this particular month. As I mentioned, seats are 30, 20 seats are finished, 10 more seats. Actually, we have some pre-booking, but not confirmed till payment. So those of you wishes, please confirm us again in our messenger that you are admitting so that, we keep your seat actually. All right. So good night, everyone, again one more time.